Introducing Dr. Hal Blattman, a medical visionary and founder of the Blattman Method and the Blattman Health Institute and Wellness Center, who's changing the game when it comes to your health.
The idea is to demystify your questions and tell you the truth about what medicine really is. Because medicine is not what we were taught, especially if you have pain. Pain is definitely not what we were taught.
Dr. Blattman is not your ordinary doctor. He's a medical expert who's incredibly knowledgeable, witty, and has a passion for helping people truly understand their health. His talks are not just informative, they're eye-opening. Dr. Blattman keeps his audience engaged with his unique blend of humor and cutting-edge insights into holistic health.
The second is regenerative medicine. You know, you can regrow cartilage in a worn-out knee. You can regrow a rotator cuff tendon. You can restore your brain from dementia, your heart from heart failure. So, all about putting the body back together, biohacking your physiology to get it to put you back together, because really, you're the only one who can put you together. You just don't know how to do it without some help.
His interactive approach means your questions are not just welcome, they're encouraged. You'll leave with a renewed sense of empowerment over your health.
You're going to find that this is pretty tender.
Oh, yeah.
The wound that created that is right here. Feel how sore this is. I can push here and you don't care, but if I push right there, that hurts. You got that wound, you were 6 years old, holding on the monkey bars for dear life, afraid to let go and drop to the sand. This makes a lot of your hand pain. All you got to do is unkink that. Now check your hand out and see if it feels better.
It feels a little better. Yeah.
A little better.
Yeah.
So all you've got to do is more of that.
So I have been diagnosed with RA for about 13 years now, and what Dr. Blattman did was he massaged out my tendons in my arms, and that made like an immediate relief of some of the pain in the foot and the hand, and that was really neat to see because it's difficult for me to feel immediate relief with anything. I was expecting to learn something from the luncheon today, and what I walked away with most importantly was an appointment with Dr. Blattman, and excited to see what happens next.
Dr. Blattman believes in holistic health, getting to the root of the problem rather than just masking the symptoms. He gets to know each patient and helps the body heal from within, making him a leading expert in treating conditions once thought not possible.
And then the third thing is, once you understand how a biology loses resilience, and you know how to biohack the physiology to get it to put itself back together, now you can treat Lyme, mold, COVID, chronic fatigue, fibromyalgia, and we also treat cancer. I taught that holistic means you're working from the awareness that you don't fix anything. The body fixes itself, and your job is to facilitate that process. And then your job is to help the body transition where it can't do it on its own to get over the hump of something. I take the best of everything and put it together in one place. So I will use pharmaceutical drugs. And I will use bioidentical hormones. I will use pain drugs. I will recommend medical marijuana. I'm part of that system, but I won't use the things that are harmful, and I'll get you off the drugs that don't work and show you a better way.
There is so much information that we have all been taught as a society is the right way to think about diet, nutrition, pain, medicine, medical care, and it's mistaken. It's not up to date with what science actually shows us, what we have learned, and what we innately know as humans is what's good for our bodies. And Dr. Blattman teaches us about nutrition, what causes pain, where does it really come from, and turns what most of us have been taught on its head and teaches us how we're really in control and can be in control of our physical experience and how we live, how we can thrive. I want somebody watching this video to gain knowledge about their body and what can actually be done to help them heal and to experience more thriving and vitality in their life, even to the possibility of healing dementia.
Are you ready to transform your health journey? The time is now to take your first step towards a healthier you. Hope and healing starts here. Don't live with pain any longer. Call Dr. Blattman today in our Cincinnati or Manhattan office. If you have an event or gathering, Dr. Blattman is available to inspire and educate your audience. Visit his website for a wealth of information on his services, expertise, and upcoming talks. For more information, visit blattmanhealthandwellness.com.
You've had concerns about your left knee for quite some time. How long has that been actually bothering you?
Doctor, about a year and a half ago, my left knee, and I would have difficulty and I would be concerned whether, literally, if I could walk across the street.
When did you start using a cane? When did you start using a brace?
Actually, the first doctor that I went to was a surgeon, and took the x-rays, and he told me immediately upon looking at the x-rays, you have very bad arthritis and you need a knee implant. And I just wanted to wait. So I wanted a second opinion, so I went to another surgeon, and that's a second surgeon. He just said, we'll go slow. Started using the brace and a cane, and then I stumbled upon your YouTubes because I had read and watched so many YouTubes about knee surgery, about this and that, about knee. I was delighted and made initially I was very interested to hear your story. Delighted that I made the appointment and came and met you.
You asked me once, what are the odds that this is actually going to be successful?
Right. That's right.
And I said, can you totally straighten, and how far can you bend?
That's right.
And you still had a pretty good preserved range of motion. So,
Yes.
and you came in, we showed you what parts of your fascia injuries caused the pain.
Yes.
We helped your body heal from them. Then we used glucosamine preparations to help your body restore cartilage. And then we eventually went to stem cells.
That's right.
And so now this is 2 weeks after that or so.
Yes.
How long has it been since you've used your brace?
I haven't used the brace in about 2 months, and today, sitting here in New York with you in your New York office, this is the first time I have come on the train ride to come to New York without the cane in about a year. So today, no brace, no cane, and I'm feeling good.
And no pain.
Yes, that's correct. What you have done, Doctor, has been amazing.
Hi there. Have you been told that your joint is worn out, that your joint pain comes from worn out cartilage, and that your joint is bone on bone and needs to be replaced? Well, if you can totally straighten your knee and you can bend it 90 degrees or more, there is no way through this range of motion that your joint is actually bone on bone. The cartilage is rather thin and rather worn, but if you can still move, you have enough cartilage left to possibly regenerate cartilage in your joint and save it and not need your joint replaced. Here's an example of a knee that we helped restore, where the cartilage is very worn out and very thin, and a year after stem cell injections, we are able to see that the cartilage has regrown, the vertical dimension and space between these bones has increased. So, it might be possible, just like this case, to save your joint from replacement. So, you have a lot of pain in your hip. You've been told your hip is bone on bone and you need a new one. Well, you know, total hip surgeries have been around for a long time, and most of them do really well, but sometimes things go awry. Well, how can you tell if it's going to be easy, or more difficult to save your hip? And the primary thing is not pain, the primary thing is range of motion. When you lose cartilage in a hip, the first thing you lose is the ability to internally rotate the joint when it is flexed 90 degrees. Flexion of 90 degrees is what you do when you sit in a chair. Internal rotation is moving this way. So you're going to find that as the hip joint wears out, you can get 90 degrees, but you can't internally rotate. If you can internally rotate one of your hips way more than the other, the one that doesn't do so well is the one that's in more trouble. Well, the better your preserved range of motion, the easier it is to save your hip. One other thing to look at that helps give you an idea that this could be a lot more difficult, look at the x-ray. If the ball of your hip joint is still round and isn't flattened on the top, you have a much better chance of saving the joint. We've still been able to save them with it a little bit flattened, but it does make it more difficult and does make the process more of a project. What does it take to save a joint? A finger joint, a knee joint, an ankle joint, a hip joint, a wrist joint. They all have the same kind of physiology. They've worn out ahead of their time. The other joints in your body are more okay than this one or two, and so now you've been told that your joint is bone on bone. I've already shown you, check out the videos. How do you know how difficult it's going to be to save your knee? How do you know how difficult it's going to be to save your hip? But when you go to do the process, the big deal is, can you balance wear and tear with your biologic ability to restore? There are orthopedic textbooks that say once your cartilage is worn out, you just can't do anything but replace the joint. And I started to wonder many years ago whether that was even possible to be true. I mean, look, you grow new skin every 7 to 10 days, you grow new fingernails, you grow new hair, you grow new brain cells and new heart cells. Does it make any sense that our biology can't repair cartilage from daily wear and tear? So the reason this joint wore out faster than the other ones is you have an injury to that cartilage sometime in your lifetime, maybe multiple injuries. And those injuries have injured the resilience of the cartilage, so it wears out faster in that joint than all the other joints from normal daily wear and tear. So, how can you correct that? Two things need to happen to balance this equation, or there's two places you can reach. One is to wear your cartilage out more slowly, and the other is to grow it more quickly than your body can do on its own. To wear it out more slowly, we teach you to take smaller steps. We teach you to use elevators and escalators. We teach you how to preserve the joint. And then, to grow cartilage more quickly, one of the things that becomes most important is you need to do something every single day that can help you grow cartilage more quickly. And for that, we rely on glucosamine. Well, glucosamine works for knees. Glucosamine by mouth works for knees as long as you have a brand that works. If you've been taking glucosamine for your knees and you have a brand that works and you don't think it's helping, it's not because the glucosamine isn't working, it's because your pain is not coming from your joint. The pain comes from the fascia and the tissue that holds the joint together and helps the joint to move. For your hip, oral glucosamine supplements, I've never seen them work. Not the hyaluronic acid, not anything. The thing that works best to help your body grow cartilage faster for a hip joint is glucosamine through your skin applied with a cream. And we've actually developed a cream that's prescribed in the pharmacy that you can use 3 or 4 times a day on most any joint in the body, and it will help that joint recover. Well, there you have it. That's what you have to do to help balance wear and tear with your body's ability to restore. And then, once you have that balanced, and you've proven that you can make that work, whatever you do at a point in time, you don't have to talk about how long till it wears out, because you're sustainable, possibly for your lifetime. And now we can talk about exosomes, peptides, platelet-rich plasma, and stem cells.
Be sure to take advantage of our current sale. Get 25% off of all of our IV therapy treatments in the month of February. Hydrate and heal faster and give your immune system a boost after the long winter cold. Try one of our many IV solutions, including vitamin C, Myers cocktail, mistletoe, and more. IV therapy is great for those suffering from fatigue, recovering from chemotherapy, have frequent migraines, and many other conditions. This is a limited time offer. Book now while supplies last. See the front desk for more details.
Orthopedic textbooks tell us that we cannot grow cartilage in worn-out knees, Look at the wear and tear in the right knee and left knee, and look how much cartilage has been restored using peptides, glucosamine, diet changes, PRP, and stem cells. You can regrow cartilage in worn-out knees. I'm here today with Max. We've been working on his knees for several years, and he has some interesting story to tell.
Well, the first time I was back in 2007, I was having severe problems with my knees. The orthopedic surgeons were telling me I had to have them both replaced. I was going to Italy. Dr. Blattman at that time gave me PRP injections, and they made a huge difference. It continued to improve. I didn't have to have my knees replaced. Now, it's lasted for years. Started to have some problems again last year. Well, I recently had Dr. Blattman give me more PRP injections, and I'm exercising again. I'm able to walk. I'm able to walk on a regular treadmill, bearing full weight, and I'm slowly building up. It's terrific. If you've got joint problems, I strongly urge you to at least give Dr. Blattman a call and ask what he can do for you. It sure beats having surgeons cut me open and possibly making mistakes. Things do go wrong. I've seen it happen to other people. This is a far better alternative. Dr. Blattman, he'll take great care of you.
We are excited to announce that Dr. Blattman will be speaking at the 2024 Integrative Healthcare Symposium at Hilton Midtown in New York, New York, held February 15th through the 17th, covering the topic of fascia, how to understand pain and how to treat it.
Well, good morning, and you guys have had some wonderful stories to tell. We had stem cell injections done about how long ago?
It's been about a year.
Mine was exactly a year, March.
And yours was for pain, and yours was to see what it could do for diabetes, right?
Correct.
And so what's happened with your diabetic numbers in the last year?
Well, about, I'd say 3 weeks after the initial procedure, I always maintain a record of my sugar numbers, and they dropped consistently about 10%, and that has been maintained.
Nice.
I had my 6-month checkup and had a blood test, and my A1C was 6.3, down from 6.6, and then I just had another one 6 months later, which would have been in December, and my A1C was 6.1. And I take no medicine. It's all diet and exercise, plus the stem cell, which I attribute to that reduction, because I was seeing that sugar number, that fasting sugar number, slowly creeping up over the last 4 or 5 years. And that was one of the reasons I wanted to see what the stem cell could do for that. So it's not like it cured my diabetes, but it has ameliorated the symptoms, so that's good.
And so your blood sugars, they used to be around 140 in the morning, is that right?
They were getting up there.
And where are they now?
They're down anywhere from, the other day I had one at 97, which was, that's abnormal.
That's a good
really
number
low.
for you.
It's really good for me.
Mm-hmm.
And I would say that most of them are in the teens and low 20s, 115 to 125. It varies though. It depends on what I eat. If I'm not watching my diet as well as I should, I can monitor those changes. But I would say, from a management point of view, when I look back at the numbers over the last few years, those numbers are comparable to one of the earlier numbers that I had when I was just diagnosed.
Awesome. And yours was for pain. What's happened with that in the last year?
Right. Well, the first thing, mine was in March when I had it done, and I was due to get my full physical with my doctor in June, and I didn't do anything different. And I had exactly the same tests done for all the blood work and everything. And I hadn't done anything different, and everything was good and down about 10 to 15%. Cholesterols, triglycerides, everything. And everything was normal. That was the first thing I noticed. And then as I went along another month or two, I would notice when I would pick up my twins, my grandson twins, and with my medicines too, I could heal a lot faster.
So when you were too physically active and you hurt yourself, you repaired better.
Yes, I noticed that, and I noticed it. I noticed it more and more, and that's what I just was talking about this morning with you. That I still notice it. You know, it's really helped me a lot. Yes.
Most awesome. Well, thank you very much for sharing this. People need to know what this work can do.
We're very happy that we did it.
Be sure to take advantage of our current sale. Get 25% off of all of our IV therapy treatments in the month of February. Hydrate and heal faster and give your immune system a boost after the long winter cold. Try one of our many IV solutions, including vitamin C, Myers cocktail, mistletoe, and more. IV therapy is great for those suffering from fatigue, recovering from chemotherapy, have frequent migraines, and many other conditions. This is a limited time offer. Book now while supplies last. See the front desk for more details. New at Blattman Health and Wellness Center. Apollo Health's Recode and Precode programs for reversing and preventing Alzheimer's disease and other cognitive decline-related illnesses. The Recode program is the first clinically proven program to reverse early-onset Alzheimer's disease. The Recode and Precode programs were developed by Dr. Dale Bredesen. He split Alzheimer's disease into 6 different subtypes based on risk factors in your own biology. These include inflammation, vasculature, trophic loss, glycotoxicity, toxicity, and trauma. Recode focuses on those already exhibiting cognitive decline issues, and Precode focuses on prevention. The program includes 7 different strategies to focus on, including nutrition, exercise, sleep, stimulation, detox, stress, and supplements. For the program, you'll get access to a personalized report based on your labs and cognitive function, access to brain stimulation workouts, connection to a Recode certified practitioner, an online support community, and access to a variety of other information and resources. The protocol was seen to be 84% effective in reversing early on-stage Alzheimer's disease. It was also seen to help some of those in the middle to late stages.
Hello, I'm Sally Weinrich, and I'm living proof that Alzheimer's can be reversed. For over 7 years, I've been following Dr. Bredesen's Recode protocol. That's short for reversal of cognitive decline. Alzheimer's starts small. The first symptoms can look like normal aging changes. And Alzheimer's may take 20 years to fully develop. I had aunts and uncles, 2 on each side of my family, that died from Alzheimer's. So you can understand why I was terrified when I had my first major memory problems in 2000 when I was only 52 years old. We were living in a home with black mold, and at that time I had no idea that mold can cause Alzheimer's disease. Now I'm 75 years old. It's 23 years later, and thanks to Recode, my cognition is good. I am convinced that if I had not followed the Recode protocol, I would already be in a nursing home with advanced Alzheimer's, or perhaps, even more likely, not here at all. In 2015, before I heard about Dr. Bredesen, I joined a multi-center national study designed to test whether the removal of beta amyloid plaques from my brain would delay Alzheimer's. I stuck with it for 8 monthly treatments. But then I withdrew because each treatment made me even more confused than I was before the treatment. After my husband showed me Dr. Bredesen's article on reversal of cognitive decline, I decided to try Recode. I have discovered more benefits in my life from following Recode than I can begin to name. There are also challenges. For example, my brain thinks much more clearly when I eat a plant-based ketogenic diet. A small device that I breathe into measures whether I am or am not ketogenic. Limiting my carbohydrates can be tough. I really miss my whole wheat bread. Some days I do leave out parts of the protocol, but most of the time I just do it and tell myself I'm going to keep my brain working. If not for myself, then I'm doing it for the ones I love. The RECODE protocol includes physical exercise, since exercise increases the blood flow to the brain. After exercising, I notice right away that I'm thinking more clearly. I'm currently practicing for a 2-mile swim across Lake Murray here in South Carolina. Each time I practice, I try to swim a little longer. This is kind of like the RECODE protocol. I keep doing it regularly, and my brain gets a little bit better each time. Practitioners trained in Dr. Bredesen's RECODE protocol, such as Dr. Susan Brott, have been essential to my recovery. They have identified and treated undiagnosed contributors to my cognitive decline, including sleep apnea and toxins. Today, I no longer have those awkward conversations where I cannot remember what I want to say. And most importantly to me, I don't get mixed up and call my grandchildren by their wrong names. Following the RECODE protocol has kept my life worth living, and it can do the same for you. And so I invite you to consider, right here, right now, in what way does my story apply to you? How much do you want to keep your brain and your personality? How will choices you make today not affect only you, but the ones you love? Thanks to RECODE, I look forward to treasuring what brings me joy, my family, my friends, and beautiful sunsets. What are you willing to do to create a future you can treasure together with your loved ones?
Dr. Blattman and our nutritionists and music are certified RECODE practitioners and can help guide you through the program. Please contact us today if you or someone you know is exhibiting traits of cognitive decline.
This is our IV therapy room. We do various different IV nutrients and various intravenous treatments to help people recover from Lyme disease, help people recover from chronic fatigue, and many other issues. Hi there, I'm Dr. Hal Blattman. I have medical offices in Cincinnati, Ohio, and Manhattan, New York. And what I'm here to talk about is that pain is not what we were taught. People suffer in chronic pain needlessly. People go to the doctor expecting to help, and your doctor never even touches you. Well, there are real answers for real problems of chronic pain, and they're not what we were taught. Most of your pain is not coming from your disc. It's not coming from your nerves. It's not coming from inflammations we were taught to understand it. It's coming from a lifetime of injuries to the fascia that holds you together. You can be shown how to change that fascia with your bare hands. You can be shown how to help your body heal, and we can show you what we can do to help your body heal when your body doesn't have the tools and resources to do that. I've included some of this in an article I just wrote for New Holistic Life magazine. I encourage you to get a good read on that. I'm Dr. Hal Blattman, wishing you a very nice pain-free day.
Hello and welcome back to A Better World. This is your host Mitchell J. Rabin, and I'm very glad you're joining us again today. Today we're going to have a very interesting show. I have invited Dr. Hal Blattman on. Hal is a specialist in pain, one of those things we rarely like to talk about or deal with. Yet, he has found ways of dealing with it and understanding it that have changed the field. And he has an extraordinary background actually in pain management. He's written a book on the subject. He's traveled the world giving lectures on it. And he's here today to educate us about the nature of it. And we can learn a lot. I've been learning a lot just recently about how to understand what it is and what we can do about it. So Hal, great to have you.
Mitch, wonderful to meet you too, and wonderful to be here. Thank you so much.
Absolutely, my pleasure. So you've been educating me about this. Now I'd love to educate our audience about another understanding of what pain is and where it comes from and what to do about it. So where do you want to start with this?
Well, let's start with some of the things that we've been taught that aren't so true, just to kind of level the field.
Yeah, please.
Because we've been taught that pain comes from inflammation. We've been taught that pain comes from nerves being pinched by discs. We've been taught that bulging discs might cause pain. All those things. And most of what we were taught about pain is not the way our biology works.
But does inflammation cause pain?
Inflammation causes a reaction in our body that makes pain worse. So yes, inflammation can cause pain. But at the same time, our bodies are designed to have inflammation for two main reasons. For repair and for defense. If we have inflammation that's causing us pain, we have a repair deficit. We have an injury big enough that we're not able to repair it, and our biology has to shift to a defense mode and make us hurt.
Oh, as a signal.
As a signal.
Okay. So you're making a point that I do know about inflammation, because we tend to just say to that. Inflammation, and that's not the case.
No, we don't want to.
It serves the purpose.
Right.
It serves, as you said, the repair purpose, etc. It's just that when it gets excess and is not doing the repair, the pain signals started.
Yeah. Ankle sprain is a good way to think about that. What are we taught to do with ankles? We're taught to ice them and wrap them and
keep them,
right? Ice
and nobody knows what to do. You know, there's a bit of a toss-up about which direction to go in.
Over the field. When you sprain your ankle, what does your body do with it? Does it warm it up or does it cool it down?
Heats it up.
Why does it heat it up? Couple reasons.
To bring blood to the area?
To speed up metabolism, because you warm things up, they metabolize faster.
Yes, right.
And to increase blood flow, because that's going to speed up healing. Don't you think our biology, in however many thousands of years we are old, maybe 30,000, don't you think by survival of the fittest, if that was really going on, our bodies have figured out how to heal us as best they could without the surgery in the hospitals and stuff? And so your body heats it up because that's the right thing to do.
Mm-hmm.
If you cool it down and you go home and put ice on it and take anti-inflammatory drugs, you've just stopped
the body's natural inflammatory process, which it needs for the healing.
And now you're not going to heal as well. You've just taken away your potential and ability to heal and decreased it. There's a wonderful study that was done several years ago giving Army recruits...
Let's appreciate the irony of that, Hal. You know, right? Exactly.
But there was a study.
How did that happen?
And these Army people were given meloxicam, which is an anti-inflammatory drug. Mm-hmm. And those who took the drug got back to work faster, had less pain and less swelling. But 6 months later still had unstable ankles that were uncomfortable because they never healed.
Removal of the symptoms, the pain symptoms, and no healing.
Right. So you want that part of inflammation.
Yeah.
You don't want the inflammation that causes the pain. Well, it turns out a lot of the inflammation that causes pain is a reaction in the fascia that holds us together caused by the food that we shouldn't be eating.
Okay, so the plot thickens.
The plot thickens. So aside from the injury, which we still haven't gotten to, that's really the source of the pain. What makes those injuries light up, like you just plug them in and set all the light bulbs up,
is the food
that causes an inflammatory reaction in your body that you should never be eating.
And those foods are?
Bread flour, sugar, potato, fruit juice, artificial sweeteners, fake fat.
All my favorites.
All the things that are not real food.
That's right.
Right?
Right.
All the things that are not addictive.
Real.
But they really nutrient. Yeah, the things that nutrient you don't do that.
Right.
Nourish. That cause the inflammation that don't nourish you as well. They may keep you from getting skinny and they may keep you from looking like you haven't been fed. And they may make you really big, the opposite of looking like you haven't been fed.
Right.
Because those foods that we just mentioned, we call big people food. You can never be a big people eating little people food. Right? You have to be. And the big people food causes inflammation that makes you hurt.
So interesting. So pain would almost be subacute had it not been for these inflammatory foods, which really light the whole thing up.
Even more so, and just to drive that point home a little bit, I have done this experiment where once a year I've gone out and skied. Now, I used to ski when I was a kid, so I've got a skill set, but I haven't done it in 20 years. And so I put skis on and think I can do what I used to do, where I'm no longer strong enough to do that. But you can imagine that I pulled on my strings pretty hard, and I really worked with the skiing.
Yes.
You get out of the car after the hour drive home, and you know how that feels. And you're worried about the next day. And I went home and I took my warm shower, massaged my muscles, and did all the things that I woke up the next day fine. Not because I didn't have any injuries from the day before, but because my food was so clean that my body repaired those injuries under my radar and didn't even let me know that I was hurt.
That's very instructive.
And to make sure it wasn't a fluke, I've skied 3 years in a row, 1 day a year, and repeated it 3 times.
Painlessly.
Painlessly. A little bit of discomfort, but nothing like what you would expect from doing a very strenuous activity that you're foreign to because you haven't been warming up or just go right into a marathon.
Sure.
You should be pretty miserable the next day. Except for I didn't eat any of the food that would have inflamed my healing response, and my body just worked with me.
So, this is a slightly altered understanding of the mechanism of pain. When someone comes to you, Hal, what happens? Give me an example, if you would, please, of, maybe someone in particular who came and got your treatment and has been suffering for umpteen years, and then all of a sudden, voila, some changes.
So, most people have an idea of where their pain comes from. They've seen other specialists who give them also those ideas. So the first thing I want to do is listen to what you've been told and what you've learned, and then also hear how your body has progressed, if it's progressed, rather than going backwards. And then the key is, I need to touch you. And you'll find, or what I find, is that many patients who have pain, the doctor has never touched them. Their diagnosis has been by X-ray, by MRI scan. Your chiropractor looks at you, who touches you? Because he has to adjust it. And your diagnosis is the X-ray and what he reads on the X-ray, and then what he feels secondary. Your orthopedic surgeon doesn't really touch you. Your orthopedic surgeon and your neurologist pokes you with needles to see where you're numb, then orders an MRI scan and an X-ray, and shows you where your disc is pinching on a nerve and that you need surgery, and still hasn't touched you.
As a therapist, a counselor, and acupuncturist, I'm deeply offended by this fact. It really is. It's someone who has been in touch with, no pun intended, the healing power of touch, and knowing how children need to be touched, or they do not get proper brain development. I mean, that's how serious and important touch is in infancy. And you can just extend that same understanding forward for the rest of one's life, and oxytocin release, etc. That's how important.
One of the most bizarre things I ever heard in a pain conference was a specialist from the American Pain Society who said, we encourage physical therapists not to touch the pain patient, because then the pain patient will want to come back to therapy just to be touched, and they won't ever be discharged. Isn't that sick?
Profoundly.
Well, that's what our colleagues have been taught for all these years. And what we're trying to show is, most of what we were taught about pain is not the way our biology works. And if you think about it a different way, most of the chronic pain people suffer with can actually go away. And that's what we're here to talk about.
Exactly.
An entirely different paradigm.
So go into, if you would, an example of someone that you've worked with. They come in, they've been getting standard conventional treatment, it's not working, and those are the people I imagine are coming to your doorstep.
Yes. Headaches too. And headaches don't come from your head. And if you can touch the piece that sends off the headache, and people realize, oh, that's where my headache is.
Oh, yes.
And just do this and see how they go away, and they don't come back. That means changing your food, that means working on your body, that means unkinking the fascia from the injuries that you've had through your lifetime. So the most important part of what I do on the first visit is we touch. And you'll find that we have a skill set that we've developed, that we can also teach, that I can touch your body and by your texture, the texture of your fascia, know where your injuries are through your lifetime and know where you're tender without you having to tell me where to find it.
Well, the body is telling you.
Your
The
body
fascia
will tell
is
me.
telling.
So I will usually introduce that by,
Sure.
let's find out two things. One, let's find out what your body can teach us that you may or may not know.
Right.
And second, the most important thing, let's find out if what I feel on my side of your skin is the same thing you feel on your side of your skin without you having to tell me. Because once you know that I feel what you feel, the average chronic pain patient goes to a new doctor with one thought in mind, or one, I need to convince this doctor that I really have a problem, that I'm not faking, that my pain is real. That is a major concern of people with chronic pain, whether they're going to be believed.
It makes sense, because the other side of all of this is that pain is very subjective.
Right.
And it's
And
not
it is.
measurable
Your
as
experience
such.
of it is subjective.
That's right.
Your injuries are not.
That's right.
And if I can show you them, and as I'm touching your body, you go, wow, how did you know that was tender? I didn't tell you. And you realize that I know what's going on in your body. And that changes our relationship in the first 10 minutes.
Absolutely. So you were telling me how about a woman from Long Island
Yes.
who recently came.
And she's had pelvic pain and headaches and pain all over her body for a long, long time.
Yes.
She's been in therapy for a long time. And her
Physical therapy.
therapist sent it to me.
Mm-hmm.
And I find these injuries all over her body, show her where all this pain is coming from, and then I take out my tools of the trade and unlock the fascia strings that are binding her and holding her in pain. And now this is 4 weeks later, and so much of her pain is gone from that one visit. And what she's been able to do in physical therapy is remarkably different with the strength and the exercises that her therapist has her doing. Another real profound success is a woman with rheumatoid arthritis. She's in her early 30s, so she got it in her early 20s. She had too many vaccines at one time, is what it's been attributed to. And by the time she gets to me with this 10-year history, her fingers are going sideways, her knuckles are swollen. She can't move this elbow. If you look at the x-ray, you almost can't see the bone. It's so faded, there's not enough calcium. And she moves it by holding her other hand. And I have to put needles and do work on her arm. And I can't move her elbow, she has to. That's her first visit with me. This woman has had platelet-rich plasma, stem cells, peptides, a very clean diet, all herbal medicines, everything we could do. And now it's 3 years
Since she
later,
started coming
Since
to
she
you.
started coming.
Mm-hmm.
She can wear gloves on her hands now she hasn't been able to wear in years because her fingers aren't so swollen. She came in last time, she can actually move her elbow without the other hand holding it.
Can you see the elbow now?
We ordered x-rays. We're hoping we can see the elbow. She's able to work 2 jobs, and 3 years ago she was an invalid. She couldn't work at all. And the people that the society where she belongs have decided it's better to spend several $1,000s and help her body recover and restore from this awful, this devastating process and make her a productive member of their society rather than having to support her as an invalid for another 60 years, paying for her medical care and her doctors and her drugs.
And that she's depressed because she can't do anything.
And even if she lives that, and then she can't cook for herself, right. And now she's no longer crippled. She can work 2 jobs. And she had a really bad case of rheumatoid arthritis, and her biology is restoring her body and putting it back together as best as it can.
Because that's what biology does.
Exactly. And with the work that we've been able to do, she's making this happen. Well, this is true not just for headaches, but for pelvic pain, for the pain you think might be coming from your prostate. You know, if your doctor suspects a prostate infection, antibiotics might be the right thing. But 6 months of doing that, it can't be an infection. Something else is causing the pain. And nobody knows how to touch you, and nobody knows where to look for it.
Well, you're bringing up a whole interesting subject that has interested me forever because I've been studying the body in many different ways through the lens of Chinese medicine, and because I was exposed to Rolfing very early in my life, when I was a teenager, I came to appreciate the power and role of fascia. Not nearly as developed as yourself, of course, but I had I had a kind of a view into the structure of the body, and not to mention body language and posture language and all of that, and what it says, speaks, and how we hold ourselves, etc.
Symptoms of carpal tunnel syndrome include waking up in the morning with numb and painful hands that you have to shake before they start to feel normal. Your doctor might have prescribed an EMG test to see if your median nerve is pinched at the wrist, and you might be wearing a brace during sleep. The next step might be a cortisone injection into your wrist, and if this is not successful, surgery might be planned. The surgical procedure involves cutting through the ligament on the palm side of the wrist in hopes to release pressure on the median nerve underneath. The statistics I've read show the surgery has a success rate of 50% good results and 50% not so good results. And overall, 30% of those not good results are pretty unfortunate. Medical textbooks teach that carpal tunnel syndrome is caused when the tendons in the wrist get inflamed and swell. Many doctors think this is not correct, partly because microscope research has failed to demonstrate this suspected inflammation. The osteopathic literature in the 1990s reported a study where stretching fascia from the chest to the palm of the hand relieved symptoms and converted a patient's positive EMG test to normal. In addition to diet changes and specific vitamins, we prescribe and teach these exercises at the Blattman Health and Wellness Center. They are carefully outlined in my book, Winner's Guide to Pain Relief. We find these exercises very helpful for at least 50% of the people we see with carpal tunnel syndrome. If these treatments are not enough, we have been performing a special injection under ultrasound guidance as an alternative to traditional carpal tunnel surgery. During the past several years, we have demonstrated a 90% success rate of relieving numbness and pain. There is mild discomfort with the procedure, and there have been no bad results. Approximately 30% of treated wrists require a second procedure during the next 4 to 6 weeks. Treatment has been amazingly successful, and there is little downtime for most people. The dentists we have treated have gone back to work the next day.
Be sure to take advantage of our current sale. Get 25% off of all of our IV therapy treatments in the month of February. Hydrate and heal faster and give your immune system a boost after the long winter cold. Try one of our many IV solutions, including vitamin C, Myers cocktail, mistletoe, and more. IV therapy is great for those suffering from fatigue, recovering from chemotherapy, have frequent migraines, and many other conditions. This is a limited time offer. Book now while supplies last. See the front desk for more details. New at Blattman Health and Wellness Center. Apollo Health's Recode and Precode programs for reversing and preventing Alzheimer's disease and other cognitive decline-related illnesses. The Recode program is the first clinically proven program to reverse early-onset Alzheimer's disease. The Recode and Precode programs were developed by Dr. Dale Bredesen. He split Alzheimer's disease into 6 different subtypes based on risk factors in your own biology. These include inflammation, vasculature, trophic loss, glycotoxicity, toxicity, and trauma. Recode focuses on those already exhibiting cognitive decline issues, and Precode focuses on prevention. The program includes 7 different strategies to focus on, including nutrition, exercise, sleep, stimulation, detox, stress, and supplements. For the program, you'll get access to a personalized report based on your labs and cognitive function, access to brain stimulation workouts, connection to a Recode certified practitioner, an online support community, and access to a variety of other information and resources. The protocol was seen to be 84% effective in reversing early on-stage Alzheimer's disease. It was also seen to help some of those in the middle to late stages.
Hello, I'm Sally Weinrich, and I'm living proof that Alzheimer's can be reversed. For over 7 years, I've been following Dr. Bredesen's RECODE protocol. That's short for reversal of cognitive decline. Alzheimer's starts small. The first symptoms can look like normal aging changes, and Alzheimer's may take 20 years to fully develop. I had aunts and uncles, 2 on each side of my family, that died from Alzheimer's. So you can understand why I was terrified when I had my first major memory problems in 2000 when I was only 52 years old. We were living in a home with black mold, and at that time I had no idea that mold can cause Alzheimer's disease. Now I'm 75 years old. It's 23 years later, and thanks to RECODE, my cognition is good. I am convinced that if I had not followed the RECODE protocol, I would already be in a nursing home with advanced Alzheimer's, or perhaps, even more likely, not here at all. In 2015, before I heard about Dr. Bredesen, I joined a multi-center national study designed to test whether the removal of beta amyloid plaques from my brain would delay Alzheimer's. I stuck with it for 8 monthly treatments. But then I withdrew because each treatment made me even more confused than I was before the treatment. After my husband showed me Dr. Bredesen's article on reversal of cognitive decline, I decided to try RECODE. I have discovered more benefits in my life from following RECODE than I can begin to name. There are also challenges. For example, my brain thinks much more clearly when I eat a plant-based ketogenic diet. A small device that I breathe into measures whether I am or am not ketogenic. Limiting my carbohydrates can be tough. I really miss my whole wheat bread. Some days I do leave out parts of the protocol, but most of the time I just do it and tell myself I'm going to keep my brain working. If not for myself, then I'm doing it for the ones I love. The RECODE protocol includes physical exercise, since exercise increases the blood flow to the brain. After exercising, I notice right away that I'm thinking more clearly. I'm currently practicing for a 2-mile swim across Lake Murray here in South Carolina. Each time I practice, I try to swim a little longer. This is kind of like the RECODE protocol. I keep doing it regularly, and my brain gets a little bit better each time. Practitioners trained in Dr. Bredesen's RECODE protocol, such as Dr. Susan Brott, have been essential to my recovery. They have identified and treated undiagnosed contributors to my cognitive decline, including sleep apnea and toxins. Today, I no longer have those awkward conversations where I cannot remember what I want to say. And most importantly to me, I don't get mixed up and call my grandchildren by their wrong names. Following the RECODE protocol has kept my life worth living, and it can do the same for you. And so I invite you to consider, right here, right now, in what way does my story apply to you? How much do you want to keep your brain and your personality? How will choices you make today not affect only you, but the ones you love? Thanks to RECODE, I look forward to treasuring what brings me joy, my family, my friends, and beautiful sunsets. What are you willing to do to create a future you can treasure together with your loved ones?
Dr. Blattman and our nutritionists and music are certified RECODE practitioners and can help guide you through the program. Please contact us today if you or someone you know is exhibiting traits of cognitive decline.
I'd like to discuss for a couple minutes why carpal tunnel syndrome happens. We were taught when we went to medical school, and with a predominant view today, is that when you do a lot of this kind of motion with your fingers, the tendons that go through your wrist canal or carpal canal have to move. They get inflamed from all that activity, and that pushes on a nerve that runs right behind this ligament that connects these two sides of your wrist. And the surgery is to make an incision through this wrist and then through that ligament, let that ligament separate, sew up the skin, and let you go home and figure it out. That relieves pressure of the structures that go through this canal. And if we send the cover of those tendons off to the pathology lab, there's no evidence of that supposed inflammation. So maybe that theory doesn't hold any wash. There's two others that I'd like to talk about. One is, in order for your fingers to do this really fast, you have to hold your wrist really still. And to hold your wrist really still, that requires a sustained contraction of your biceps muscle. And while the biceps muscle ends here at your elbow, the fascia that goes through this muscle and holds it together continues all the way to your palm and fingertips. And as this muscle stays contracted, the fascia tightens. And then the fascia in your forearm tightens. And then this ligament actually tightens, and the canal through your wrist gets smaller. So it's not that the structures inside the canal swell up, it's that the canal actually shrinks. And the articles that describe that were written in the osteopathic literature back in the mid-1990s, and they talk about a set of stretching exercises that we teach still today, where you stretch the forearm biceps, you stretch the forearm, that we still teach today, where you stretch the biceps, the forearm, the transverse carpal ligament, and there's a set of stretching exercises that we describe in my book, Winner's Guide to Pain Relief, that talks about how to relieve your symptoms of carpal tunnel syndrome, thinking that the cause is from all of this fascia tightening and this shrinking. The cause is all of this fascia tightening and the canal actually shrinking. In actuality, the case reports show that not only do carpal tunnel symptoms get better, but a positive EMG test, which was the gold standard and still is considered the gold standard for carpal tunnel screening, that test can go from positive to negative just with this set of stretches. We've described them very well in my book. Another theory for carpal tunnel syndrome is that many of us through our lifetimes have used our hand as a hammer. Hand's not meant to be used as a hammer, and that causes injury to the carpal canal, especially adhesions or stickiness between the ligament that covers and the nerve that goes right behind it. And if there's any adhesions or stickiness, when you open and close your fingers, the tendons obviously have to move, but the nerve has to move through this canal also, because the nerves go all the way to the fingertips. And if the nerve is stuck on the back of that ligament, when you open and close your hand, it doesn't move well. And if you tug on a nerve every time you open and close your hand, that nerve gets very unhappy and you get the symptoms of carpal tunnel syndrome. The fix for that is we do a needle surgery and hydrodissect. That means we put a needle through here and use fluid to separate the nerve from the ligament so that it can flow freely in this canal. No incision, no sutures, very uncomplicated recovery afterwards. 30% of the cases that we've done have required a second procedure, but we have 90% good results and 0 bad results. Whereas if you go for carpal tunnel surgery with the traditional incision across your wrist, that has 50% good results, 50% not good results, and 30% of them can be disastrous results where you have chronic issues perhaps for the rest of your life. There are different ways to handle carpal tunnel syndrome. We hope we've helped you. If you have been told that you have a bone-on-bone joint that needs to be replaced, or you have joint pain that physically limits you and you want to try and avoid joint surgery, this information is for you. I'm Dr. Hal Blattman, and in this short video, I will discuss what I have learned in 30 years of medical practice with regard to restoring the cartilage in your joints. As you would expect, our bodies wear out with time, use, and abuse, and so does the cartilage in our joints. To compensate for this wear and tear, our bodies rebuild and regrow cartilage in every joint, every minute of every day, unless there is nicotine or anti-inflammatory medications like ibuprofen in our blood. Research has shown that both nicotine and anti-inflammatory medications decrease cartilage growth and repair. That's right, the very medications that are prescribed for joint pain stop the body from healing and repairing the joint. And if a joint has been injured in the past, the cartilage may wear out unusually fast during normal use, and the joint will show degenerative change before its time. At the Blattman Health and Wellness Center, we have been treating worn and degenerative joints for more than 25 years. We have learned that some oral glucosamine supplements work very well to restore knees. If you are taking the recommended dose of a brand of glucosamine that works, you should feel better in 2 or 3 months, as long as you do not kneel, smoke, or take NSAID medications. If you have taken oral glucosamine in this fashion and it did not work for you, then the brand you chose did not work. For a quicker effect and for all other joints in the body, glucosamine must be applied through the skin or injected into the joint. Both of these choices work very well. Our patients experience tremendous benefit from oral, transdermal, and injected glucosamine. If you need even stronger healing, we offer options of injecting platelet-rich plasma and even bone marrow stem cells into your joint for restoration and healing. If you are suffering with joint pain and are satisfied with your current range of motion, there is a good chance the treatment we offer can help that motion restore to pain-free. We not only treat knees and hips, but joints of the jaw, neck, shoulder, elbow, wrist, ankle, fingers, and toes.
Hello friend, Henry Flowers here. I've been an avid tennis player for about 8 years, and I remember the night when I had flaming, excruciating pain in my tennis arm, and I ran over to Dr. Hal Blattman's court. See, he had spoken to me a couple of days before about the treatment that I needed to fix my arm, and wasn't really interested in it then. But when that pain flared up on my arm, that pain said, "Henry, you're not playing tennis again." And I ran over to Dr. Hal's court and I said, "Hey, when can we get an appointment?" Went into his office, did the treatment. The treatment wasn't covered under my insurance, and I didn't care, because in a very short amount of time, the treatment turned into transformation. And with the work that he showed me how to do, how to work the tendons, just real simple stuff that I did at home, I was back on the tennis court in a very short amount of time. 2 days. It transformed my life. I highly recommend Dr. Hal. You do not have to live with pain. I'm proof positive. I'm playing tennis longer and stronger than I ever have before. Tennis elbow is no longer my enemy. Thank you, Dr. Hal. I recommend Dr. Hal. Go see him. Get it done today.
Be sure to take advantage of our current sale. Get 25% off of all of our IV therapy treatments in the month of February. Hydrate and heal faster and give your immune system a boost after the long winter cold. Try one of our many IV solutions, including vitamin C, Myers cocktail, mistletoe, and more. IV therapy is great for those suffering from fatigue, recovering from chemotherapy, have frequent migraines, and many other conditions. This is a limited time offer. Book now while supplies last. See the front desk for more details.
I get to see that every day in my practice, because most of my practice now is using light therapy for so many different conditions. So it's been an incredible journey with you, Maurice. The day I met you was a day that changed my life.
The original photonic stimulator, which my father Maurice created in 1998, output 250 milliwatts. As of now, one of our wands for the Firefly is outputting 37,710 milliwatts, well above any of the class 4 lasers or any of those devices which carry a much heftier price tag. The near-infrared has been shown to permeate at our power levels up to 20 centimeters, which is 8 inches. So that's the second advantage, is not one, not two, but 8 different wavelengths that can be used in any combination. We are very excited with the treatment of neurocognitive conditions, including Alzheimer's, dementia, Parkinson's, multiple sclerosis, and even ALS, Lou Gehrig's disease. Another great feature of the Firefly is my father Maurice's design of very complex electronics to create different waveforms to potentially kill pathogens, viruses, and bacteria, and parasites. The patient is first scanned with an energetic testing machine called F-scan. And in 2 minutes, the F-scan software is able to come up and tell by name all of the parasite, bacteria, and viruses that the patient's immune system is fighting, and the frequency, the resonant frequency associated with those pathogens. I had one patient pass a 3-foot tapeworm after one Firefly treatment, after an F-scan, of course. The patient that passed the large worm was a 38-year-old female with mental fog and fatigue for no reason. After passing the worm, she was back on herself, and she had been suffering with this for 5 years.
2 weeks ago I came and I did my very first treatment, and immediately, that very same day, I saw results, and I'm just so pleased with the treatment that I'm receiving. The neuropathy is almost all gone, and I'm just amazed at how it's helped me so quickly.
What's going on? Can this be that powerful? And it works on almost everybody? This is revolutionary. What's the matter with the world? It needs to wake up and see what this does, and that it can work.
Hi there. I am a patient of Brandy Moreno and Dr. Martin Bales, and I have had symptoms of IBS, or been diagnosed with IBS since teenager, early 20s, and on and off I go through it. So the last 4 months I have been having really bad symptoms. I have had, and I've been to almost every doctor. I continue to go to doctors, my primary care, other doctors. Nobody could figure it out. Went to the GI doctor. All they do is pretty much give me a piece of paper with IBS symptoms and what to eat and what not to eat. But I've done everything like that, and it hasn't worked. For 4 months, I've had ongoing diarrhea. So I would be okay, and then 2 days, every 2 days, every 5 days, 7, 10, whatever, I would have diarrhea. Not only diarrhea, but really bad, severe cramping before the diarrhea. So I would feel it, and I was afraid to go anywhere. My whole life was put on hold because of this. I'm used to being active, so I gained weight. I just pretty much in bed with the sheets, pulled up, because I just didn't want to go anywhere. I felt lousy. My quality of life was extremely diminished. And then finally, Brandy tells me, "Why don't you see Dr. Bales? We've tried everything else." So I did. At this point, I was desperate. It sounded, this thing sounded like voodoo science to me, but I didn't care, because I just needed something. So I did the F-scan first, and sure enough, things came up that I had. He asked me, "Have you gotten over a cold?" And I said, "Well, yes, exactly, last week, end of last week." So I knew that was on. Then he says to me, you have a dog?" And I said, "Yes." So there was some kind of dog bug I had that spiked up. So it registers the frequencies of bugs that live in your tract, or parasites or viruses. So The scan detected the virus, it detected the dog bug, and it detected E. coli, high levels of E. coli, and salmonella. And what's weird is that I had already been tested for salmonella maybe 2.5, 3 weeks prior in my blood, negative. Same with E. coli, negative. So he had actually identified it when I had already been tested negative for them. I was impressed with that. So we did the Firefly procedure, and all it was is just basically running the scan over my stomach, my abdominal area for 5-10 minutes, and nice and warm, and lo and behold, I go home, no more diarrhea. I mean, that day it stopped, that exact day, and since then I have not had a bout of diarrhea at all. So I continue to come here because I do suffer from a little bit of bloating, and that may be residual, but my diarrhea is gone. So I'm a believer. I've been telling everybody about it that I know. So if you're out there and you're living with this kind of condition, you got to have this done. You got to get it done. Thank you.
Hi there. Using this rubber ball, you can do a lot to massage your own body. Myofascial release makes some of your pain go away. I like to use this ball against the wall, and I can use this ball to reach parts of my body my hands can't get to. My shoulder blades, the muscles over them, and my gluteals, my buttocks, are the 4 most important areas in my body for generalized aches and pains. I start this by putting my butt right on the wall. I can take the ball up here, set it on top of my shoulder, and just by leaning forward little bits at a time, I can drop that ball down and send it exactly where I want it to go. If your butt's not on the wall and you try to do that, you'll be trying to keep the ball from landing on the floor. So, secret, butt on the wall, drop this ball down. I send it down to my bra strap. That's a good general place to go. Then stand off the wall, move your feet, maybe a foot, 1.5 feet from the wall, and then you can go up and down, covering this muscle between your shoulder blade and your spine. And I like to do this limbo. Get your belly going out, your knees going out, tilt your head back, and you can get across the upper traps just like that. And you can even just keep going like this, and that covers the muscle from your shoulder blade all the way down to about the tip of my thumb without having to go up and down and use your knees. Then I turn the ball 45 degrees, turn my body 45 degrees to the wall, and I want the ball to cover my shoulder blade from the bottom to the top. So I'm going to go against the wall. Take your arms for this position and put them across your chest and tuck them in like you're mad. If you don't have your arms tucked in, your body's going to be all over the place. If your arms are here holding on, your shoulders are going to be hiked and tense. The only way your shoulders get to relax, tuck your arms in like you're mad at somebody. Place the ball at the bottom of your shoulder blade and start doing this wiggle dance. And you'll find that you roll over this really tender rope right about there. You can stay and lean right on it if you want. You can go up and down just on it if you want, but you can also just do this because some people find leaning on it to be a little too uncomfortable, especially when you start out doing this. Now, just to see the other side, drop the ball down. You can go up and down. I like to do this limbo piece because this takes care of that cord that seems to go from your shoulder blade up your neck. And then I like to just come here and get across the top of my traps, and then 45 degrees, and do this wiggle dance to get the muscle over your shoulder blade.
Be sure to take advantage of our current sale. Get 25% off of all of our IV therapy treatments in the month of February. Hydrate and heal faster and give your immune system a boost after the long winter cold. Try one of our many IV solutions, including vitamin C, Myers cocktail, mistletoe, and more. IV therapy is great for those suffering from fatigue, recovering from chemotherapy, have frequent migraines, and many other conditions. This is a limited time offer. Book now while supplies last. See the front desk for more details.
I'm Hal Blattman, MD. Do you have pain in your lower back? Well, where does it come from? It feels like it comes from your lower back, but the only thing you can believe at the end of the day is where you can touch and feel. Where are you tender? Are you more tender here, where your lower back muscles are, right above your hip bones? Or are you more tender here, in these muscles next to your spine? Or are you more tender here, in your butt muscle? And most people with pain in their lower back, this is where the tenderness is, not here. And if that's true in you, then most of your lower back pain is not coming from your disc, your spine, or your nerves. It's coming to the injuries from your childhood and through your lifetime to your butt muscles and what holds you together in the lower part of your body. Hi there, I'm Hal Blattman, MD, and I'd like to take just a minute and talk to you about head and neck pain. Are you able to take this muscle, just wrap your fingers around it? It's a pretty big muscle. And can you feel there's ropes and cords inside this muscle? And can you also feel that they're surprisingly tender in some places? Now, take your finger and touch the top of your collarbone. Push down and massage just the very top, and you'll feel little irregularities that are also surprisingly tender. This is the injury that causes that. And the way you got that injury, you might have been an infant, and somebody picked you up by your shoulders and forgot to bring your head. Another time it happened, you were in nursery school, and somebody not happy with you came up behind you right before morning recess and shoved you to the ground, snapped your head back, and tore where the cords and strings that go through this muscle weave through the cover of this before they come down into your chest. And the results of that, through this time, here's one end of the injury, here's the other end of the injury, here's the kinks in this muscle, and here's the pain pattern of headache that causes. Hi there, I'm Hal Blattman, MD. The muscle that controls this finger starts all the way up here. If you touch this muscle and come across it, you can make that finger move. This is tender, this is more ropey and more tender, this is less ropey and less tender, and here it's gone. All over your body you'll find this texture is not tender, and this texture is. Representative of the injuries all along here. When you pull hard enough on this anchor, and the strings or fascia cords slip, they twist into a knot when the cable snaps, and this knot, big enough and bad enough, you send pain from here all the way down to your finger. Hi there. Do you wonder if you have carpal tunnel syndrome and how could you tell? Well, a lot of people, doctors, want you to go get an EMG test where needles are put in your arm and shocks are put through your nerves and muscles to measure how fast the current goes, knowing that if you have a blockage and a pinch on that nerve somewhere, that the test will be abnormal. But in actuality, that's not the best test for carpal tunnel syndrome. When I reviewed the literature a few years ago, the best test for carpal tunnel syndrome can be done at home, and it's incredibly simple. Just take your hands and drop your wrist. That makes the room in this carpal canal a little bit smaller, and if these three fingers go numb or tingle or hurt more in the next 45 to 60 seconds, it's a pretty safe bet that that wrist on your body has carpal tunnel syndrome. No needles, no fuss, no hospital, and probably the most accurate test that we have. Now, if you do have carpal tunnel syndrome, where did it come from? If you go listen to your doctor is going to tell you what he was taught or she was taught in medical school, and that is that when you do a lot of this repetitive motion with your fingers, the tendons in this canal get inflamed, that extra swelling pushes on the nerve that we're talking about, and a pushed on nerve is not a happy nerve, and you end up with the symptoms of carpal tunnel syndrome. However, when you biopsy those tendons during the carpal tunnel surgery, and you send that to the lab, there's no evidence of that supposed inflammation. So maybe that theory doesn't really hold water. A much more important thought is that in order for you to do this fast work with your fingers, you have to hold your wrist still. And to hold your wrist still, you have to have a sustained contraction of this biceps muscle. If you do that, the biceps muscle ends here, but the fascia does not, and it goes all the way through to here. And this fascia tightens, and then so does the ligament. So it's not that the structures inside swell and get larger and there's no room. It's that the canal actually shrinks and gets tighter pushing on the tendons and on the nerve. There's one more theory for carpal tunnel syndrome, and that is that many of us through our lifetime have used our hand as a hammer. And the nerve we're talking about runs right behind this ligament that crosses over your wrist. If we go look at Fred has the same ligament right across his wrist, and the nerve runs right behind this ligament down into the fingers. The surgery in carpal tunnel surgery is to make an incision through the skin, cut this ligament, sew up the skin, and send you home with a splint. So let's get back to the third mechanism I was just talking about, and that is that there can be adhesions and scar tissue between the ligament in front and the nerve that's supposed to move right behind. And if there's stickiness between the ligament and the nerve, the tendons are supposed to move through this canal when you move your fingers, and so is the nerve, because it goes all the way out to your fingertips. And if the nerve gets tugged on because it doesn't move well, the tugged on nerve is going to give you the symptoms of carpal tunnel syndrome. That surgery is much different, and that's something we do in the office. It requires very little of anesthesia. We make the skin numb, we put a needle in through here, and we separate the nerve from this ligament, injecting fluid, done under ultrasound guidance, and the results are incredible. The results with carpal tunnel surgery, 50% of people get better and 50% don't, and 30% of them do not have a very good, happy ending. The surgery that we're doing with the needle, we're showing 90% improvement. 30% of those people have had to have a second one because the first one didn't do enough, and we have 0 bad results. If you're looking for help for your carpal tunnel syndrome, there's another way besides a needle, besides a knife. If you're looking for help for your carpal tunnel and your carpal tunnel syndrome, there is something much easier to do than a carpal tunnel surgery with much less rehabilitation. The hospitals right now can't really take you because of the coronavirus, and you can come and get this treatment. I'm Hal Blattman, and this is where we treat carpal tunnel syndrome at the Blattman Health and Wellness Center.
New at Blattman Health and Wellness Center, Apollo Health's Recode and Precode programs for reversing and preventing Alzheimer's disease and other cognitive decline-related illnesses. The Recode program is the first clinically proven program to reverse early onset Alzheimer's disease. The Recode and Precode programs were developed by Dr. Dale Bredesen. He split Alzheimer's disease into 6 different subtypes based on risk factors in your own biology. These include inflammation, vasculature, trophic loss, glycotoxicity, toxicity, and trauma. Recode focuses on those already exhibiting cognitive decline issues, and Precode focuses on prevention. The program includes 7 different strategies to focus on, including nutrition, exercise, sleep, stimulation, detox, stress, and supplements. For the program, you'll get access to a personalized report based on your labs and cognitive function, access to brain stimulation workouts, connection to a Recode certified practitioner, an online support community, and access to a variety of other information and resources. The protocol was seen to be 84% effective in reversing early on-stage Alzheimer's disease. It was also seen to help some of those in the middle to late stages.
Hello, I'm Sally Weinrich, and I'm living proof that Alzheimer's can be reversed. For over 7 years, I've been following Dr. Bredesen's Recode protocol. That's short for reversal of cognitive decline. Alzheimer's starts small. The first symptoms can look like normal aging changes. And Alzheimer's may take 20 years to fully develop. I had aunts and uncles, 2 on each side of my family, that died from Alzheimer's. So you can understand why I was terrified when I had my first major memory problems in 2000 when I was only 52 years old. We were living in a home with black mold, and at that time I had no idea that mold can cause Alzheimer's disease. Now I'm 75 years old. It's 23 years later, and thanks to Recode, my cognition is good. I am convinced that if I had not followed the Recode protocol, I would already be in a nursing home with advanced Alzheimer's, or perhaps even more likely, not here at all. In 2015, before I heard about Dr. Bredesen, I joined a multi-center national study designed to test whether the removal of beta amyloid plaques from my brain would delay Alzheimer's. I stuck with it for 8 monthly treatments, but then I withdrew because each treatment made me even more confused than I was before the treatment. After my husband showed me Dr. Bredesen's article on reversal of cognitive decline, I decided to try Recode. I have discovered more benefits in my life from following Recode than I can begin to name. There are also challenges. For example, my brain thinks much more clearly when I eat a plant-based ketogenic diet. A small device that I breathe into measures whether I am or am not ketogenic. Limiting my carbohydrates can be tough. I really miss my whole wheat bread. Some days I do leave out parts of the protocol, but most of the time I just do it and tell myself I'm going to keep my brain working. If not for myself, then I'm doing it for the ones I love. The Recode protocol includes physical exercise, since exercise increases the blood flow to the brain. After exercising, I notice right away that I'm thinking more clearly. I'm currently practicing for a 2-mile swim across Lake Murray here in South Carolina. Each time I practice, I try to swim a little longer. This is kind of like the Recode protocol. I keep doing it regularly, and my brain gets a little bit better each time. Practitioners trained in Dr. Bredesen's Recode protocol, such as Dr. Susan Brott, have been essential to my recovery. They have identified and treated undiagnosed contributors to my cognitive decline, including sleep apnea and toxins. Today, I no longer have those awkward conversations where I cannot remember what I want to say. And most importantly to me, I don't get mixed up and call my grandchildren by their wrong names. Following the Recode protocol has kept my life worth living, and it can do the same for you. And so I invite you to consider, right here, right now, in what way does my story apply to you? How much do you want to keep your brain and your personality? How will choices you make today not affect only you, but the ones you love? Thanks to Recode, I look forward to treasuring what brings me joy, my family, my friends, and beautiful sunsets. What are you willing to do to create a future you can treasure together with your loved ones?
Dr. Blattman and our nutritionists and music are certified Recode practitioners and can help guide you through the program. Please contact us today if you or someone you know is exhibiting traits of cognitive decline.
Well, good afternoon. Today's your second visit, and you have many positive changes in your life just in these last couple weeks. Can you talk about them?
Yes, I have to remind you that I got some changes even before I saw you from your work, because you made a video on YouTube about your treatments for pain, and you suggested to refrain from dairy. And I refrained, I changed my diet, and you gave me more things to change. And as a result, almost immediately, I'm almost 100% pain-free. I mean, I was at level 8 and 9. That was the only way you could get me off milk, because I thought it was okay to eat cream. I'm already off wheat. That's no problem.
Mm-hmm.
But I thought, oh, I can have my cake and eat it too. I can just have lots of ice cream, lots of dairy. And I didn't realize that it was inflammatory. And I would never have listened to you if I weren't at level 8 and 9. Up before then, I'd go, yeah, 6, it's no big deal. But when I got desperate, and I'm 79, so I'm aware that I may be totally disabled. And my independence is really important to me. And I was getting more and more restricted. I couldn't get out of my chair without thinking. I couldn't walk. I would like to walk to the bank and make my own banking, but I couldn't do it because I couldn't walk that far. It was too painful. I'm on the 3rd floor of my building. I would like to be able to walk up and down stairs, but I can't. I can if I really walk slowly, but I have to pull with my arms, and I'm afraid of falling. So these are all the things that improved. I'm getting better sleep. I can get out of my chair without thinking. That's so important. You know, what if I feel like getting an extra helping of things from the refrigerator? Nope, can't do it until maybe it gets to be more of an emergency because it hurts too much. I love exercise. I would love to exercise. I've had physical therapists tell me that I could avoid hip replacement by more exercise. I can exercise because it's so painful. I can't think or concentrate. I'm in so much. I used to be. Now I can concentrate. I did something last week that I could never have done before.
What was that?
I'm the secretary treasurer of a tennis club, and we had a very contentious meeting with people kind of wanting one thing and other people wanted another thing, and there was a lot of arguments, and I decided to write up, I'm the secretary, so I decided to write up a complete account of what everybody said, and I could remember it. I could write up the account and think of things that might help people, things that we could do for them. And it took me about 3 hours. I could never have done this before. Just would be too exhausted. I'm also able to bend down and pick things up. I'm not perfect at it, but before you would look at this thing that obviously needed to be picked up. I'm a good housekeeper. It would bother me to have globs of food on the floor, but I would just go, yeah, maybe I can leave that glob of food on the floor. Who cares if we get a few mice? And now I can clean it up. It may seem like a silly thing, but I do enjoy that. And also, my exercise tolerance, and you may think exercise tolerance, 1,000 push-ups, whatever. No, exercise tolerance means walking to the bank. It means being able to maybe do a few wall push-ups, maybe 2 or 3. After I did these things, a wave of tolerance, a wave of distress, pain, fatigue, it would overwhelm me, and I just had to give up on such activities, and I felt bad.
And you were saying you walked 5 blocks on the way here today?
Yes, not only did I walk, I sort of half ran part of it. I thought I was late.
And then you also were able to put your shoes on now?
Yes, I have extreme difficulty putting on shoes and socks. I kind of sit there, you know how you can get a little bit more stretch if you just kind of sit there. But let's say I'm in a hurry. It can't work. I have to take 10 minutes to put my shoes on because I'm in too much pain. And I managed to figure it out, but last week I was able to lift my leg and put my socks on. The socks are the worst. The shoes are better because they're open, but the socks are closed. It takes 2 hands for the socks, and my leg won't rise. So I can do it, but I've been saying you're about 2 months from barefoot. You know, it's so wonderful. I really, really appreciate it. The other thing is, I don't know if I mentioned I can go up and down stairs. but I used to have a lot of vertigo. I've had this all my life. I've been in pain most of my life. I had a whiplash injury. So I never thought that I would get this much improvement. I just kind of thought, I'll be happy if you get me from an 8-9 to a 6. That'll be, and you've already done it. It's I don't think I've ever gone above a 6 this last week.
That's amazing.
It truly is.
Do you have anything you want to add? I'm so glad you're willing to share this.
Yes. I don't know if this is because of pain, but I found myself unable to concentrate. I couldn't get through this video, and I may be talking too much, but the ability to remember, marshal my thoughts, that has made a big difference. And also, I'm starting to get more energy. My husband died in 2017. I've always had very low energy. After he died, I was his major caretaker. I had no energy. I just had zero energy. And it gradually got better. And then more recently, after COVID, I'm not able to do much exercise at all because COVID closed all the parks and the gym and everything. And as a result of constant sitting and immobility, I got even more pain. And I got more tired. So maybe tired is related to pain. So whenever I tried to do more, I would get vertigo. And if I tried to push myself, and we all should be able to push ourselves on occasion, like, maybe a friend wants you to stay up late night to talk a bit or something. I couldn't do any of that. My friends invited me to be with them, and I had to say, no, I can't be with you. I can't do anything after 6 p.m. If I'm out, what if I get that vertigo and I have to go right away? It'll take me maybe half an hour to get back to my house and I might fall down. And now I can do things like go to that meeting. That was an outdoor meeting at 7 p.m. It lasted for almost an hour and a half with everybody yelling at each other. And I was able to tolerate that without getting severely stressed. Most of the time I had up and down surges of I'm anxious, I have to do this, and then I'm so exhausted I can't do anything. And I'm more steady. I'm still tired, and I still am not going out late at night. I mean, late at night meaning after 8 p.m. But I'm so much better. I feel like I've been under lock and key and can't do anything. And I'm even aware as I'm talking to you, I'm starting to tense up. And that anxiety and, reactivity makes things worse. But your treatment has made things enormously better, and I'm very, very grateful to you.
You are very welcome, and I'm very much looking forward to your progress as we go forward.
Thank you.
Be sure to take advantage of our current sale. Get 25% off of all of our IV therapy treatments in the month of February. Hydrate and heal faster and give your immune system a boost after the long winter cold. Try one of our many IV solutions, including vitamin C, Myers cocktail, mistletoe, and more. IV therapy is great for those suffering from fatigue, recovering from chemotherapy, have frequent migraines, and many other conditions. This is a limited time offer. Book now while supplies last. See the front desk for more details.
Hi, I am Tammy Kolschmidt of Thermography for Health New York, and I'm here today with Dr. Harold Blattman.
And I'm Hal Blattman, Blattman Health and Wellness Center in Cincinnati and Blattman Integrative Healing in New York City. And we're going to talk today about prostate cancer screening, and taking a look at the mouth, because what goes on in the mouth actually seeds the prostate and increases the risk and the inflammation in the prostate that does this to men.
Yes, thank you. So before I started thermography, I was actually a dental hygienist. And looking in the mouth, I would see so much inflammation, and I wanted a tool that would allow me to look at the whole body to actually see where else there's inflammation, because I know if it's in the mouth, it's somewhere else in the body.
Mm-hmm.
So that's where thermography comes in.
Because you can actually see heat, and heat reflects blood flow, inflammation, and all kinds of other. It can even reflect how hormones are not balanced in the body.
Correct.
So what can we see with the prostate in thermography?
So what I'm mostly saying, when I do a prostate imaging, I look at the gut, right? Because that is part of the mouth, 1, 2. I also look lower at the prostate and the testicles. So we are looking for heat imbalance. And oftentimes you'll see a prostate marker, and the man might say, well, but my numbers are fine.
Right.
The thing of it is thermography picks things up often before blood tests do, before the chemistry starts to shift.
Right.
You can see a temperature change.
Which is when you want to see it before you get any of these symptoms. So you're going to pick this up before there's even an ill health effect that can be determined. Correct.
Yes, because again, with thermography you can see things that you do not feel. And you tell me, you're the MD, but isn't it, by the time a man feels like there might be a prostate issue, isn't it a little bit already inflamed and swollen?
You know, it's like the principle of driving your car, and you like cars. When the red light goes on your dashboard, is it really a new problem? Or has it been a problem for a long time, and then all of a sudden, the straw that broke the camel's back, and now you've got a light? Well, your light in prostate is your PSA test goes high, and you've got a Gleason score and a prostate cancer. And so this looks under the hood at what might cause that prostate inflammation. And if you're a man who's already got prostatic hypertrophy, you've already got some urinary issues, we can look at that, see that, make changes in the mouth, we're going to talk about in just a minute, and reduce that inflammation in the prostate and reduce those symptoms before you get into more trouble.
Exactly. Well said. So let's go to the mouth, because I think you covered it with the prostate. When we're looking in the mouth, we're looking for hidden infections below the gum line, but it could also be an infection in a tooth or in the bone. But the key is that those hidden infections cause an inflammatory cascade. And honestly, like you said earlier, some of those bacteria can seed prostate cancers.
Yes.
So what do, you start by cleaning up the mouth, and then hopefully with whatever other treatments you're doing, you can get things under control before it turns into a really problematic disease.
And then we have ways to actually directly treat the prostate. We can inject ozonated oxygen into and around the prostate, which changes this inflammatory response. As soon as you put oxygen, the body can do a lot of healing it can't do without.
Right.
And we can also, for men, we can inject mistletoe into and around the prostate, and mistletoe can kill a cancer.
Very cool.
So the mouth ties in again, doesn't it?
Yes.
I'm Dr. Hal Blattman, Blattman Health and Wellness in Cincinnati and Blattman Integrative Healing in New York City. www.blattmanhealthandwellness.com.
Thank you. Tammy Kohlschmidt, thermographyny.com.
Have a wonderful day. Hi there, I'm Dr. Hal Blattman with offices in Cincinnati, Ohio and Manhattan, and I'm here today with Tammy Kohlschmidt.
Hello, I am from Thermography for Health, New York, and Dr. Blattman and I are currently working in the same office.
There we go. And we'd like to talk to you today about breast cancer screening using medical infrared imaging for breast cancer screening, and then also looking at the mouth and the importance of looking at the mouth when you're doing breast cancer screening and considering your risk for breast cancer.
So the base thing that I see when we're looking at breasts is we're looking for asymmetries, temperature patterns, things that might be different from one breast to another.
Right, and we're looking at the breast with a heat camera to be able to see temperature changes and also the pattern of the blood vessels through the breast.
Correct. We want those blood vessel patterns to remain stable at all subsequent visits.
And what makes the blood vessel pattern unstable? How do we link that to high risk or low risk for cancer?
Well, the moment the blood vessels change, it's called angiogenesis. And in that instance, that is usually a sign that a tumor is definitely present.
And the blood vessels are changing to be able to deliver more blood supply and nutrition to a developing tumor.
Correct.
So we'll be able to see evidence that a tumor has a high probability of being there by looking at this rather benign test that doesn't involve any radiation, doesn't involve any squeezing or touching, and is a whole lot less uncomfortable than the alternative.
Yes, correct. And from working in the mouth, the thing that I've correlated through the years is that many people who have inflammation in their breasts also have a lot of bacteria in their mouth that we actually test by a microscope. So we can actually see in real time the amount and the types of bacteria that are present.
And you and Dr. Winnick here actually have been doing that microscope work for some time, introduced that to me, and we took that to Cincinnati. So now with our medical infrared imaging and breast cancer screening, we also are looking at the mouth under the microscope. And what are we seeing? What kind of correlation patterns, and what do we do about it?
Well, anytime there are things like spirochetes or short rods, these are all types of bacteria that we know are connected to several diseases in the body. Several types of cancers, as well as Alzheimer's, diabetes, heart disease. So when we see that, we know that there is a bioburden, there is an inflammatory response happening, even if the patient doesn't feel it.
Right.
So what we do is we approach the mouth with something we call periotherapy, which is ozone irrigation, laser treatment, deep scaling and root planing, and then several other adjustments to their home care.
And this actually decreases those biofilms and decreases those bacteria that are in the mouth. And we've been able to see in literature searches of research articles in medicine that the bacteria in the mouth actually seed the breast and increase that risk. So we're actually able to get underneath the hood and mitigate or make that risk lower, especially if we see evidence of a high-risk breast on the infrared imaging study.
Yes, I love that you said under the hood. I like cars. But it's true. There aren't many parts of your body that you can just open up and look into. That's why the mouth is so key to really, if you see inflammation in the mouth, chances are it's moving through the body. And then the beauty of thermography is that you can do the imaging and actually see it.
And you can see the evidence of it, and then you can also study down the road at some point in time and show that you've made the changes you want to make and decrease this person's risk.
Yes.
Very good. I'm Hal Blattman, Blattman Health and Wellness Center, Cincinnati and Manhattan, and
Tammy Goldschmidt, Thermography for Health, New York.
www.blattmanhealthandwellness.com and
www.thermographyny.com.
Have a wonderful day.
Good morning, everybody. I'm Dr. Hal Blattman, Medical Director at the Blattman Health and Wellness Center, based in Cincinnati, Ohio. And I'm here today with...
I'm Clint Cornell. I'm a physician assistant and health educator with the Next Direct Primary Care Network.
Also in the Cincinnati area.
Yeah.
So we're going to chat today about thyroid. And one of the things that is really important is how would you know that your thyroid is low? How would you know it's not functioning as well? How would you know that you even need to investigate this question? So what are the main things that people should know about how to find out that their thyroid is low?
Yeah, we see people come in with very vague symptoms. They can include brittle nails, dry hair, brittle hair, thinning hair, fatigue, weird skin rashes, difficulty losing weight, brain fog. Those are a few of the common symptoms that we see.
Agreed. And the things that really just spark to thyroid, because some of those things on the list could be multitudes of issues. But the ones that really sing to the thyroid song are the fingernails chip and crack, or they're really thin and don't grow. Hair gets brittle and starts to fall out. The skin is really dry. And, some people say, well, my skin isn't dry. Well, do you put lotion on? Yeah, I put lotion on it every day. Well, why? Well, because it's dry. And especially the bottoms of the feet crack in the wintertime. So if those things are happening to you, your thyroid is low. Well, some people, their doctors tested them for their thyroid. And so their doctors told them they're normal. Let's talk about that controversy for just a few minutes.
Dr. Blattman, one of my favorite things to treat and investigate with patients is this topic of thyroid disruption. And we know that in traditional medicine, when we go through medical school or medical training and residency and so forth, we're taught to look at a couple of lab values, and if the patient's numbers are within a certain range, then we're taught that the thyroid is working the way it's supposed to work. But the thyroid pathway is so much more complicated than just a couple of numbers on a lab test. Most people, if they've had their thyroid checked, have probably heard of a test called a TSH, and that stands for thyroid stimulating hormone. And it comes from the brain when the brain detects that there's not enough thyroid hormone in the blood. And we can get into this a little more this morning, but there's so much more going on with the thyroid pathway that when we just simply look at the TSH lab test, we are really being short-sighted, and we oftentimes miss underlying thyroid pathology.
Right. So when I do a thyroid lab, we already know that your thyroid is low. We're not doing the lab test to see if you're low. We're doing the lab test to make sure it's safe to give you thyroid hormone as an experiment. And basically, anytime your doctor prescribes a medicine for you, he's doing an experiment and you are the lab rat. And what we want to know is if we do a thyroid test and your thyroid numbers come up really high, then it's not safe to give you thyroid medicine. Something's really wrong, and maybe we need to look down deeper and find out what else is going on, or maybe you even need an endocrinologist. But if your thyroid levels are anywhere close to the normal range, not high, middle range, low, even sometimes high middle range, we'll still give you some thyroid medicine and see what happens to you. And if your fingernails correct, your hair corrects, your skin corrects, it's not dry, you don't have to put lotion on every day anymore. If those things happen to you, then we know that your thyroid level is probably pretty close. And then we do a lab test and make sure that what we've done is safe. In that fashion, we can do responsible thyroid care. And the other, piece that people come in with is, my doctor has me on thyroid medicine. And usually, it's going to be Synthroid or levothyroxine, they're the same thing. And once you're on thyroid medicine, you think everything is corrected and treated. But even if you're on thyroid medicine, if your hair, skin, and nails aren't right, thyroid medicine isn't working right. And that's more the point. And what we find is that Synthroid doesn't work that well. Sometimes it works fine, numbers are fine, skin, hair, nails are fine, but how many times do you see people with taking Synthroid and taking thyroid medicine, and they still have an abnormal thyroid or abnormal thyroid function?
I would bet that more often than not, when a patient comes in and I see that they're on Synthroid or levothyroxine, if I make the bet that their symptoms aren't controlled on that, more often than not, I'm correct. And I think really what you're pointing out is this notion that in medicine we treat patients and symptoms, not numbers on a lab test. People aren't a number on a lab test. They're individuals with symptoms and physical exam findings and histories, and part of thyroid treatment, probably the majority of thyroid treatment, is digging into those symptoms. And as we were talking, one of the main symptoms we often see with thyroid is this idea of cold intolerance. People who are always just a little cold, they can't get warm enough. That's another one that comes to mind. But when we talk about medication, I think it's helpful to understand that the thyroid hormone really comes in several different forms. There's an inactive form that the thyroid produces. We call that T4. And it's this T4 or inactive thyroid that is the medication form. That's the levothyroxine or Synthroid. The body has to take that inactive form of thyroid and convert it to something called T3, which is the active form. It's the T3 that binds with the receptor and does the work, so to speak. And so if you aren't able to convert the T4, the inactive form, to an active form, well, your blood levels might look okay, but your symptoms aren't going to improve.
Exactly right. And so you walk around with a blood level that's relatively normal. Your doctor looks at it and says, well, your thyroid is normal. And you look at him and go, well, my skin isn't right, my nails aren't right, my hair isn't right. What is the deal? And so we, long time ago, got into a very good habit of treating the person rather than treating the lab test. And there's other things that can throw that lab test off. Like, one of the things we test often is thyroid antibodies.
Yeah.
You can have high levels of thyroid hormone and your immune system is taking it out of circulation and not letting it do its job. So the numbers have all kinds of reasons to not be effective. And you can't measure thyroid function by just measuring blood levels, because that doesn't tell you the whole story of what's going on. And then you mentioned temperature. Let's talk about that for a minute. You know, that's not something you can always just correct by taking Synthroid or taking thyroid medicine, but how many people do you see whose normal so-called body temperature is 97? And weren't we taught that normal is 98.6? Can you address that?
Yeah, there's a high proportion of people who come in, and we'll catch this when we do their vital signs in the office. You'll measure a temperature and they're 96.8 or 97.4, whatever the number might be, but it's consistently lower than that normal temperature that we're taught to look for. And one of the old-fashioned ways of diagnosing an underactive thyroid is actually to have a patient measure their basal body temperature over a period of days and track that. And we still use that technique today. So temperature is a very critical part of evaluating the thyroid.
But temperature doesn't always come up when you're taking thyroid medicine. A lot of people with normal functioning thyroid medicine, hair, skin, nails, and so forth, and their temperature is still 97. And so what we say to these people is that 97 is never normal. It might be what you run at, but you're supposed to run at 98.6. And the reason for that is that most everything in our body happens by chemical reactions of one form or another. And if these chemical reactions were left on their own to go at their own pace, everything would happen really slowly in our body. So if our temperature is below 98.6, all the chemical reactions in our body happen slower. And the chemical reactions in our body don't happen at their own pace. They're all catalyzed by something we call enzymes. And enzymes are often vitamins that we take. And these enzymes allow chemical reactions to happen very, very quickly. But all these enzymes in our body have an optimum operating temperature, which happens to be 98.6. So if your body is running at 97, that means all of the chemical reactions in your body, including the ones that help you heal, are all running slower. So if your body's running slower and your metabolism is a little slower and you'd like to speed that up, one of the things you can do is look up Wilson's syndrome. Look it up online. Do you know much about that, Clint?
You know, Dr. Blattman, I'm familiar with it, but I'll let you elaborate more.
So Wilson syndrome, you can look that up online, and you can download or buy and purchase the physician manual of how to treat it and the patient manual of how to treat it. And I would suggest you get the patient manual and look through that, because that will tell you what correcting this is going to take. It usually takes a few months of cycling T3, low doses, and then raising the dose, and then bringing the dose back down again, all with the purpose of correcting your body temperature and getting it back up to 98.6. We've done this a few times. It's not a comfortable process. It's not a particularly uncomfortable process. It does take a few months, and you can reset your body temperature back up to 98.6 if you're tired of running at 97 and you're willing to go through the 3 months of what it takes to reset that. All right, let's talk about some of the brilliance. Why the brilliance of the biologic design of T3 and T4. You mentioned that T4 is produced by the thyroid gland, and then the body has to convert that to T3. Well, the brilliance of that is that if the body's thyroid gland, which is right here in your neck, put out active thyroid, then all of the body parts close to here would get a lot of it, and all the body parts far away, like your fingers and your toes, they would get it last, and there might not even be any by the time the thyroid hormone gets to them, right? So the thyroid T4 gets secreted by your thyroid, circulates all over your body, and your body converts it when it gets to where it needs to be. So everything in your body gets thyroid at the same time and gets enough of it, because it converts in your big toe the same way that it converts in your fingers, converts close to your thyroid. So distance from thyroid doesn't make any difference, and that's one of the brilliant things in design about why and how the body does that. What do you most often prescribe? We've just spoken about how Synthroid doesn't work. Levothyroxine in many people just doesn't work. So what do you use instead?
Well, when you brought up the Wilson's protocol, one of the reasons that I defer that over to you, I haven't used it in a long time, because it's a very difficult protocol, and it's hard on the patient, and it's a lot of work. And so we find that it's not very many folks who are willing to or able to go through that successfully. But if you have the right patient and they're motivated, you're right, that can be very effective. What we tend to look at in terms of treatment, especially our medication options, is a product that has an amount of the T4, the inactive thyroid hormone, but also one that contains the active thyroid hormone, the T3. And our preference is something called Armour Thyroid. And actually, this was a little tidbit that I picked up hanging out with you, is because the Armour Thyroid comes from a big source. You get that messenger RNA that, every once in a while it might help rejuvenate the thyroid gland. So I found that was very interesting. We always went with Armour as a first-line therapy because it had both inactive and active thyroid hormone, but that messenger RNA tidbit, I think, just reinforced that choice even more.
How do you know you're getting too much thyroid?
Well, again, we go back to symptoms. So if someone's starting to feel like they have tremors or shakes, or they're anxious, or their heart rate is too high, if they're feeling excessively warm, hot, those are signs that your thyroid level is too high, and we're back on.
Agreed.
Yeah.
Agreed. And so when we give people their first doses of thyroid, we're really doing an experiment, and the person is essentially the lab test. And so if your thyroid levels are right, your hair, skin, and nails correct. If your thyroid levels are too high, then you get an uncomfortable beating in your chest. Your heart goes a little too fast. It's not dangerous. It's not something to worry about, but it's not comfortable. And as soon as you stop and bring your thyroid levels back down, it goes away just in a few hours, and you don't use that dose again. I rarely see that happen, but that's your safeguard. So that's how you can tell if your thyroid is too high. If it's too low, you're looking at your hair, skin, and nails. if you're taking thyroid medicine and you're still putting lotion on the bottoms of your feet and your heels are still cracking, your thyroid isn't up to snuff, and the medicine you're taking isn't working really well. And then there are some people, just like we were just talking about, who come in and tell me, Doc, I haven't seen you in a while, and I need to let you know about this thyroid thing. About 6 months ago, I started to feel those palpitations in my chest, so I lowered my dose, and it went away just like you said it would. And 2 months later, it came back, and I lowered my dose again. Well, I got to tell you, I haven't taken any thyroid medicine in the last 2 months, and my hair, skin, and nails are just fine. And that's what we're talking about. The messenger RNA in the pig parts that are included in the T3, T4 preparation actually helps your thyroid gland rejuvenate itself and take back over again. So that never happens with levothyroxine, but I've seen it happen a number of times with these other preparations, and there's a few, there's more than just Armour Thyroid, and they're all made basically the same way. Some of them are dairy-free, some of them are gluten-free, not all of them are everything. It depends on the fillers and how it's all put together. But you can look at and research the particulars of that. Another thing I'd like to discuss before we quit is how often do you take the medicine? Like, there are so many people who come in and they're taking Armour Thyroid or one of the others, and they're taking it once a day. And I really need to let everybody know this is not a once-a-day drug. This is a twice-a-day drug. And your dose should be even. What you're trying to avoid is a big peak blood level, a high peak from a dose that was taken once a day, and then you're without it when that goes away for the whole rest of the 24-hour cycle. So it should be at least taken twice a day. And if your dose is getting higher than that, you don't take 2 in the morning and 1 at night, or 1 in the morning and 2 at night. If you can't take 1.5 morning and evening, then you take 1 about every 8 hours and divide that up. And you try to even it out as much as you can. And then we have 2 more questions. One is, do you have to take it the same time every day? And do you always have to take it on an empty stomach? Because we hear both of those things a lot with thyroid preparation. What do you tell your folks?
So we tell them to try to take it as consistently as they can. And we also tell them to try to take it on an empty stomach, at least 2 hours fasting.
All right, and that's what a lot of folks say, but I have a more practical approach to it. I take my first one in the morning on an empty stomach, and I do that every morning. But I don't wake up every day at the same time, because I might take my weekday when I'm going to the office at 6 o'clock in the morning. I'm not waking up that early on Saturday and Sunday unless there's something that I need to wake up for. So if I wake up at 8 or 9 o'clock, that's when I'm going to take my thyroid on an empty stomach. And then my next one, because I'm on a 3 times a day schedule, my next one is about 8 hours later, and sometimes I remember, and sometimes I don't. And when I don't remember, then instead of 2 o'clock in the afternoon, it turns out to be 6 o'clock at night as I'm leaving my office, and I go, I forgot my thyroid today. I'll go take my second dose now. Well, it's not exactly at the 8 hours, but here's the point. Do you think the little man in your thyroid gland, who gets the message from up here that he's supposed to release the thyroid, do you think he ever looks at his watch and goes, wait on it, not yet, go? It doesn't do that. So we know that the thyroid gland pulses. We know that it secretes into bloodstream, but we don't know what makes it trigger to pulse now versus an hour from now. So as long as you get the dose in that your body needs for the day, your body can figure out the little things that are in between and different. And it's okay to miss by an hour or miss by 2 hours or even miss by 3, because what you're really trying to avoid is taking 2 of them at the same time and having a peak blood level that shuts down your biofeedback mechanisms that you need. So you don't overpower your biology. And that's why you divide it and do it in divided doses. Yeah, you can make it for a while taking it once a day, but usually in about a year, sometimes 2 years, sometimes even way sooner, depending on how big that dose is, your thyroid is not going to work. And here you are taking the medicine, your blood levels are maybe sky high because now it depends when you test, and you still have thyroid symptoms because that once a day doesn't correct you. So let's talk about empty stomach versus full stomach, and then let's talk about when to test. So I take the first one on an empty stomach because that's first thing in the morning. But my other ones, not necessarily so. And if you forget to take the one before dinner, then take it after dinner because you still need it. And your body, it will absorb more slowly. You might not absorb quite as much, but you're still getting it into your body, and your body will figure out some of the differences. And it's not worth making you crazy to make sure you go 2 hours before, 1 hour after, whatever that number is. That's enough to make you goofy during the daytime. So I try to tell people, just, you'll know you're doing right by your hair, skin, and nails. And as long as you're close enough and have good enough thyroid, your body will give you the right answers. So, one more, let's talk about when to test. So, you're at your doctor's office, your doctor says, let's test your thyroid. Is that ever the right answer? And I'm going to tell you no. So when do you send your patients for test?
So we usually test first thing in the morning, and after a fast of at least.
We don't do it that way. We do the test midway between doses. If you're supposed to be taking it 3 times a day, that's roughly 8 hours, then we want to test you 4 hours after your empty stomach dose. If you're taking it every 12 hours or supposed to be taking it twice a day, then we want to test you at 6 hours after your morning dose. If you test in the morning before your dose, your levels are going to be really low because your last pill was 12 hours ago. If you test right after your morning dose, your levels are going to be sky high. So that's not the right answer either. You want to know where you are midway through the day. You don't want the peak, you don't want the trough. You want to know where you are in the middle, and that is midway between your doses. If you're taking it every 8 hours, it's at 4. If you're taking it every 12 hours, it's at 6. That gives you a level that you can understand. And if you are taking my thyroid medicine and your family doctor orders a thyroid test and you do it 2 hours after you take your thyroid medicine, your levels are going to be really too high, and your doctor isn't going to give you the right answer. He's going to lower your medicine. And that's not the right answer either. So those are the things that are critical. Don't take it all at once, and make sure your lab test is timed. All right.
Okay, Dr. Blattman, if you could pick a number between 1 and 3, we're going to be awarding someone lifted infused tea samplers.
Let's pick 3.
Sylvia, congratulations. This is Taslima. She's the creator of Lifted Teas, and you can find her products at symbol Lifted LFTD Infused Tea, and that's on Instagram and Facebook. So Sylvia, you're the winner today. Is she there?
She's here. She's muted. Let me see. I can unmute her. Does all this have an effect on your liver and your white blood cells being low? I don't know. I've not heard an effect on liver and white blood cells being low. I'd be looking for something other than thyroid. Have you seen thyroid issues, low thyroid affecting white blood cells and liver?
No, there's no correlation that I'm aware of. Thyroid really is so much to do about metabolic rate and energy production in the cell. Not much correlation with white blood cell count.
But Sylvia, your issues of dry, itchy skin, cold off and on, and fatigue could certainly be related to thyroid, and once a day is not the right answer, and so now you can correct that. So take it twice a day, and if you you need a bigger dose, then if you can't split it in half, then you take it 3 times a day. All right. I'm really glad we did thyroid. That's all.
Sylvia, you may reach out to me at Dr. Tranquility, Lydia on Instagram, or Taz directly at Lifted Teas, and you will get your sampler at Lifted LFTD Infused Tea. And we will make sure you get your sampler.
Recognized specialist in treating myofascial pain. He's board certified in integrative and holistic medicine on the topic of exosomes and chronic myofascial pain, rebooting the body's self-healing mechanism. My great pleasure to introduce to you Dr. Hal Blattman. Welcome.
Good morning. Thank you, Alex. And welcome everyone else. Dr. Hal Blattman, Medical Director of the Blattman Health and Wellness Center in Cincinnati, Ohio is our base. I have an office in Manhattan and also in Seattle. I'm going to go and share screen. Share. Slide. There we go. I'm going to speak today about exosomes, chronic myofascial pain, rebooting the body's self-healing mechanisms, and specifically talk a little bit about where does lower back pain come from, how to make it go away, and show you some exciting things we've learned about scoliosis. Exosomes are tiny vesicles full of growth stimulators and growth factors given off by stressed out stem cells. They're harvested from stem cells and they can be used to help heal, repair, and grow new tissue. You can apply them topically, you can inject them into fascia, into joints, and you can use them intravenously and also into spinal cord. Let's talk what is chronic pain. Everyone agrees that it starts with an acute injury, but the world is taught after that acute injury causes acute pain, that if that pain stays longer than 3 to 6 months, it magically transitions to chronic pain, in which case we have no hope to make it go away, and what we have to do is stop the signal. So we kill the nerves, we use epidural steroids, we make the nervous system not work using various medications and TENS units. Fortunately, that's not the way our biology really works. It's just the way medical doctors were taught. Our reality is that acute pain does come from an injury. But the reality is that our body will continue, our brain will continue to experience some evolution of that pain until we heal from the injury that caused it. And it doesn't matter how many years it is, doesn't matter how long we've had it, doesn't matter what part of our body it's in, most chronic pain can be made to go away. There's almost no such thing as intractable pain. Granted, it happens. There are people who suffer. This doesn't work 100% of the time. But there's so many people who suffer that don't need to, believing that their pain can't go away. And when you heal those injuries, you can make most of this pain go away. So, where does pain come from then? How do you figure it out? And then how do you make it go away? Well, you learn from this seminar and all these wonderful speakers that a lot of medicine is not what we were taught. Well, indeed, most of pain is also not what we were taught. So, I've coined 5 rules of how do you figure out where your pain comes from. Rule number 1, you can't believe the pain comes from where you feel it. Your headache does not come from your head, not from your blood vessels, not from your nerves, not the way we were taught to believe. Your knee pain doesn't come from your knee. Just ask the people that you know who've had their knee replaced and how many of them does their knee still hurt. And the pain in your left arm could be your heart attack. You don't really know. Rule number 2, you can't believe what you think the pain feels like. We were taught to really ask questions about where does it burn, where does it tingle, where does it ache, all those varying nuances of how you perceive the pain. And truth be told, it doesn't really matter. None of those differences are diagnostic. Burning doesn't necessarily mean anything different than aching or stabbing. It all comes from the same stuff, or most of it does. It's not diagnostic. The location of where you feel the symptoms is incredibly important, but what they feel like is a backseat. Rule number 3, what can you believe? What you can believe is where your fascia is tied in a knot, where those ropey bands of muscle are really tender. those are the kinks in your fascia that generate a lot of this pain. And then if you trace that rope out to where it ends and attaches and links to your skeleton, you'll feel the injury of how did it happen. Rule number 4. The places as we examine you together, you and I, where you're most specifically tender, represent the injuries through your lifetime that cause most of the pain that you came to see me for. And rule number 5. About 90% of the time, as quickly as we can unkink the fascia that holds you together, and as quickly as we can reinforce and help you heal the injuries that happened through your lifetime, the pain you thought you had will go away. And so often, it's not a whole lot more complicated than that, with the exception of, as everyone else has said this morning, your food needs to change. So, fascia has many forms. It can be sheets, it can be strings, it can be a ligament, it can be the cover over your brain. And Tom Myers discovered by fascia-sparing dissection that it occurs in lines through the body. You can trace it from one place to the next. Here is the superficial back line of human fascia. Take a look at this video. It starts looking at the toe or the plantar fascia where foot pain may come from, the heel, the gastroc tendons, the gastroc muscles, the heel cord. Look where the hamstring and the gastrocs attach. They only tack into the back of your leg. They really attach to each other. If your hamstrings are attached, you're coordinated differently than if they're separate. So how you're put together depends on what you can do with your body or helps determine it. This is the lumbar fascia coming up to the muscles that go up your spine, and shortly you're going to see here is your neck, and then the yellow on the top is the galea that goes up over your head all the way to your forehead. You are one string that goes down from your forehead all the way down to underneath the balls of your feet. In a similar fashion, you have deep and shallow lines up the front, up the sides, spiral lines across your middle. We'll talk about that in a few minutes when we talk about scoliosis. So, in order to illustrate the point, let's feel your neck. There's a muscle right here where this green arrow is, blue arrow. Right here. You can put your hands on that. You can feel that it's really tight. You can feel a rope through that muscle. And you can feel at different places it has different levels of tenderness. That texture is what you need to know to be able to touch someone and tell them where their pain is by what they feel like in your exam. And then feel down here, right on the top of your collarbone, where this muscle attaches. And there'll be some places that are really tender. That's the injury that causes this knot. How did you get it? Maybe you were in nursery school and you walked in the morning and Sally, you just irked her just by walking in because your lunchbox was the same color as hers. And she came up behind you right before morning recess and pushed the back of your shoulder blades and tore this muscle, and you wear it in this knot, which may be causing you migraine headaches for the rest of your life. You grasp and pinch the muscle just like that. You feel it just like this, and you can feel those ropes and knots too, and if you hold on to them a little longer, you'll feel the pain go right to your eye. And when you let go, you'll find your neck moves better and your head moves better, and you've just learned how to help make this go away. And so the X's represent the kinks, the red speckles are where you have the pain pattern however you perceive it. And here's one end of the injury, here's the other end of the injury. So, if we look at lower back pain, we're taught that our pain comes from these nerves. We're taught that we injure this disc. Well, how many people do you know have had that surgery and are better or still hurt? So, if we look at these treasure maps, where is the kink, where does the pain come from? These are by Janet Travell and David Simons. Here are the ones for lower back pain. Most of the pain that you think is in your lower back comes from this tender area in your glutes. And where are the injuries? You can feel it to where the rope ends, on the top part and the bottom part. Those are the injuries where you're most tender from this lower back pain. And the fascia strings go all the way down your leg, and that's most of the reason for the transmission of the pain. And the thing you felt give wasn't your disc, wasn't your lower back. It was the tendons that hold your butt together. And where did you first injure them? When you were a child, jumping out of trees, jumping down the steps, and you were the kid that led the other kids, followed the other kids, or watched the other kids jump off the roof. So, for treatment, you make these kinks and trigger points go away. You restore and strengthen how you anchor and hold together. And then you also need to reduce the food and toxicology-based inflammatory pain. So we on our website, www.blattmanhealthandwellness.com, have a do not eat list that you can get by signing up. That do not eat list gives you the inflammatory food list for your biology. I don't believe there's one diet that's appropriate for anybody. We're all a little bit different. But I do strongly believe there's a do not eat list for our species. We need to stay away from poison or things that aren't good for our biology. So, you now know that this is tender because of an injury. You now know some understanding of the tenderness by your hips and what that means from jumping off the roof. But your body has no idea that it didn't heal you when you did that and created those injuries. And we've injured these areas many, many times in our lifetime. This wasn't just from nursery school. This was from a car accident and from standing on your head and from the cheerleading accidents and God knows what else. And every time you injure, your body runs a repair program to fix you, but at the end of the day, your body's done an incomplete job and it has no idea. So to turn on your healing program, we have to re-injure you. We do that by poking you discreetly with a needle. And then we need to put magic into the needle so your body heals faster and stronger than it could on its own. Well, if you remember, you skin your knee, you bleed, you make a scab, and 4 weeks later, the scab falls off and you have new skin. Well, this isn't any different. We take blood out of your arm, concentrate the parts that would make that scab, add exosomes, maybe add stem cells, put that into these areas as we create this wound. And in 4 weeks, 8 weeks, and 12 weeks, as the scab falls out and as your tissue becomes stronger because of what we put in, you heal and you grow a new tendon. Whether it's for your hip, whether it's for your rotator cuff, you don't really need to have the surgeries we were taught that we needed to do. So here's an example. This woman has head and neck pain, bad hip and lower back pain, and her weaknesses are where her tendons hook up and where her fascia hooks up for her thigh, for her glutes, for her neck. And so on one day we go and we do a needle surgery to repair all these areas, and a month later, look how much better she is. And 2 months later, even better than that. You are not destined to have pain just because you have old injuries that you don't know how to find and your body doesn't know how to repair. Let's talk about scoliosis. Scoliosis occurs, in my belief and my understanding, when the fascia strings that you just saw evidence of by that dissection video, the child grows and the fascia strings either don't grow fast enough or they contract pathologically, pretty much like Dupuytren's contracture when it closes the hand. And when that happens, the patient or the child can't grow vertically, so they grow in the path of least resistance, which is not an S-curve, it's a spiral. It looks like an S-curve because it's a two-dimensional X-ray, but there's a rib deformity that goes with this, and the spinal bones get deformed by the time you're 17 years old. So if we're going to help you reverse it, we need to do it while you're a lot younger. And the reason surgeries are done and rods are put into children is so that their spine doesn't become so deformed that it compromises their lung function and they can't breathe. So, this is a child. He was 13 years old. He was noted to have scoliosis by the school nurse, confirmed by the family doctor. No forward-up plans were given. 6 months later, just about a year ago, the son told the mother that the ribs were sticking out. She didn't pay attention. And last December, the school nurse noted scoliosis again, and this time the orthopedic surgeon took an x-ray, and the x-ray showed this curve that you see on the left-hand side. The father knew me, sent mom and child on an airplane to visit us, and we released the fascia that binds the child, and his second x-ray is a whole lot different. The curves changed on the top from 43 to 35, and on the bottom from 45 to 28. We're fascinated by this. It's preliminary, but it gives us a different understanding of how do we change scoliosis and prevent the surgeries that traumatize so many children. So, exosomes and stem cells can also be administered intravenously. You can accelerate healing from surgery. You can rejuvenate your body. There's all kinds of hope for many different chronic diseases. Here's arthritis. So this is a year stem cell injections into the knee. Not my data, but data presented at a conference. This is how much growth happened in a year from one injection of stem cells into the joint for this patient. Also, the immune system can be changed. You can help settle down the immune system in rheumatoid arthritis. These are the after pictures. This woman had rheumatoid arthritis for 10 years before we saw her. Her knuckles are a whole lot less swollen than they used to be. She can wear gloves she hasn't been able to wear in years. I wrote a book several years ago to help teach these concepts to people, to teach you that your pain comes from fascia, and to teach you what you can do about it. The book is called Winner's Guide to Pain Relief, available on our website, www.blattmanhealthandwellness.com. It gives you a self-help book where you can learn how to take a rubber ball, find these knots and kinks in your fascia, and massage them out yourself. And when you look on our website, not only can you order the book, but you can sign up for our community talks. Saturday morning at 9:30, I'm going to go through topics in a similar fashion to this and help teach you more about your body. Here's pictures from the book showing you how to use that rubber ball on that muscle, that knot in your butt that I showed you on a previous slide. You rub that knot out well enough, you can help make a lot of that pain go away. Unkink the knots, smooth out the fascia, and then learn how to unglue the fascia, learn how to repair the fascia so it doesn't come back. So, headache, lower back pain, pelvic pain. Pelvic pain isn't any different. Everybody thinks it's the pudendal nerve and pudendal neuralgia and psychosocial emotional trauma, which certainly is part of the deal. But you have fascia injuries that need to be repaired. They can be found, they can be repaired. Pelvic pain is pretty much a migraine. Instead of it being in your head, it's in your pelvis. Like lower back pain can be a migraine in your lower back. All these pains are caused so much by the same thing. And then, to give you insight into scoliosis, what really causes it, and what are the possibilities to help a child grow up without that curve. Want more information? We have a newsletter that comes out you can sign up for, www.blattmanhealthandwellness.com. I'm also present in New York. Our office, once a month, is 321A West 24th Street, on the west side, 8th and 24th. I also have a presence in Seattle where I'm part of the faculty at Bastyr University, a naturopathic four-year medical school. You can reach us at 844-282-8900. Thank you very much. I have some time, perhaps, for questions.
Great presentation, Dr. Blattman. Thank you so much. Anyone has specific questions? We have a minute or so here. But you've seen people resolve problems that they couldn't resolve before: back pain, elbow, tennis elbow, neck pain, all of these things.
And we do this for weekend warriors, we do it for the young, we do it for the old, we see children in the office, and we have a lot of experience with professional athletes. Things that have a lot of difficulty healing. You need to get back on the field to play. College athletes, high school athletes, there's so much we can do to accelerate healing and get ourselves back in the game.
Michael wanted to know, to what degree is moderate scoliosis to normal?
Once the spine has deformed, your spine bones actually will start to look like a double trapezoid deformity, like a spiral staircase. Once that happens, it's really hard to undo. If we get you before that happens, possibilities are pretty strong. So we'd like to see you between 11 and 14 years of age. We can always help with the pain, can always help with the discomfort, even if you're 40, 50, and 60 years old. It's rare that our work won't be helpful.
Very great. Well, thank you so much, Dr. Blattman. I appreciate your unique approach and your passion for your work. We appreciate you being here. Thank you.
Thanks, Alex, and thanks everyone for being to listen.
Be sure to take advantage of our current sale. Get 25% off of all of our IV therapy treatments in the month of February. Hydrate and heal faster and give your immune system a boost after the long winter cold. Try one of our many IV solutions, including vitamin C, Myers cocktail, mistletoe, and more. IV therapy is great for those suffering from fatigue, recovering from chemotherapy, have frequent migraines, and many other conditions. This is a limited time offer. Book now while supplies last. See the front desk for more details.
I get to see that every day in my practice because most of my practice now is using light therapy for so many different conditions. So it's been an incredible journey with you, Maurice. The day I met you was a day that changed my life.
The original photonic stimulator, which my father Maurice created in 1998, output 250 milliwatts. As of now, one of our wands for the Firefly is outputting 37,710 milliwatts, well above any of the class 4 lasers or any of those devices which carry a much heftier price tag. The near-infrared has been shown to permeate at our power levels up to 20 centimeters, which is 8 inches. So that's the second advantage, is not one, not two, but 8 different wavelengths that can be used in any combination. We are very excited with the treatment of neurocognitive conditions, including Alzheimer's, dementia, Parkinson's, multiple sclerosis, and even ALS, Lou Gehrig's disease. Another great feature of the Firefly is my father Maurice's design of very complex electronics to create different waveforms to potentially kill pathogens, viruses, and bacteria, and parasites. The patient is first scanned with an energetic testing machine called F-scan. And in 2 minutes, the F-scan software is able to come up and tell by name all of the parasite, bacteria, and viruses that the patient's immune system is fighting, and the frequency, the resonant frequency associated with those pathogens. I had one patient pass a 3-foot tapeworm after one Firefly treatment, after an F-scan, of course. The patient that passed the large worm was a 38-year-old female with mental fog and fatigue for no reason. After passing the worm, she was back on herself, and she had been suffering with this for 5 years.
2 weeks ago I came and I did my very first treatment, and immediately, that very same day, I saw results, and I'm just so pleased with the treatment that I'm receiving. The neuropathy's almost all gone, and I'm just amazed at how it's helped me so quickly.
What's going on? Can this be that powerful and it works on almost everybody? This is revolutionary. What's the matter with the world? It needs to wake up and see what this does, and that it can work.
Hi there. I am a patient of Brandy Moreno and Dr. Martin Bales, and I have had symptoms of IBS, or been diagnosed with IBS since teenager, early 20s. And on and off, I go through it. So the last 4 months, I have been having really bad symptoms. I have had, and I've been to almost every doctor. I continue at a doctor's, my primary care, other doctors. Nobody could figure it out. Went to the GI doctor. All they do is pretty much give me a piece of paper with IBS symptoms and what to eat and what not to eat. But I've done everything like that, and it hasn't worked. For 4 months, I've had ongoing diarrhea. So I would be okay, and then 2 days, every 2 days, every 5 days, 7, 10, whatever, I would have diarrhea. Not only diarrhea, but really bad, severe cramping before the diarrhea, so I would feel it. And I was afraid to go anywhere. My whole life was put on hold because of this. I'm used to being active. So I gained weight. I just pretty much in bed with the sheets, pulled up because I just didn't want to go anywhere. I felt lousy. My quality of life was extremely diminished. And then finally, Brandy tells me, why don't you see Dr. Bales? We've tried everything else. So I did. At this point, I was desperate. It sounded, this thing sounded like voodoo science to me, but I didn't care because I just needed something. So I did the F-scan first. And sure enough, things came up that I had. He asked me, have you gotten over a cold? And I said, well, yes, exactly, last week. End of last week. So I knew that was on. Then he says to me, you have a dog? And I said, yes. So there was some kind of dog bug I had that spiked up. So it registers the frequencies of bugs that live in your tract, or parasites or viruses. So the scan detected the virus, it detected the dog bug, and it detected E. coli, high levels of E. coli, and salmonella. And what's weird is that I had already been tested for salmonella maybe 2.5, 3 weeks prior in my blood, negative. Same with E. coli, negative. So he had actually identified it when I had already been tested negative for them. I was impressed with that. So we did the Firefly procedure, and all it was is just basically running the scan over my stomach, my abdominal area for 5-10 minutes, and nice and warm, and lo and behold, I go home, no more diarrhea. I mean, that day it stopped, that exact day, and since then I have not had a bout of diarrhea at all. So I continue to come here because I do suffer from a little bit of bloating, and that may be residual, but my diarrhea is gone. So I'm a believer. I've been telling everybody about it that I know. So if you're out there and you're living with this kind of condition, you gotta have this done. You gotta get it done. Thank you.
Good morning. My name is Hal Blattman. I'm the medical director of the Blattman Health and Wellness Center based in Cincinnati, Ohio, with offices in Manhattan and also some presence in Seattle, Washington. And I'm here today with Clint Cornell. Clint, good morning.
Good morning, Dr. Blattman. Thanks for having me here today. I'm a physician assistant with Next Direct Primary Care. We're located in Kenwood, just north of Cincinnati, Ohio.
We're going to talk today about chronic fatigue syndrome. You see a lot of it, you treat a lot of it yourself, don't you?
We sure do. It's a very common reason people seek out medical care.
Yeah, if it's not pain, it's just they're really tired, they're fatigued, they can't get their stuff done, and they've pushed their body for so long perhaps. Or when I look at chronic fatigue syndrome, I think of it in 5 different categories. They're not exclusive because you can have more than one at a time going on, as we all know. But the big categories are energy production, like mitochondrial fatigue, our energy factories can't work well. We might be sick, illness, Lyme, mold, Epstein-Barr, number of things that could do that. Our adrenal glands are tired, something that's called adrenal fatigue, too much stress for too long. Our food may not have enough octane for the needs that what we're giving our body to do, some form, I guess, of malnutrition. And lastly, toxicology, the low-level, daily accumulated burden of poisons, heavy metals. We've all heard about lead poisoning now. So those things lead to fatigue too. Can you think of anything else?
Yeah, a couple of things that come to mind. Certainly hormone imbalance, especially as people begin to age. That can definitely be a contributor. Also, thyroid dysregulation. We look at thyroid very differently in our practice, and I know you do as well. We have much stricter criteria when we look at blood results to suggest that there may be thyroid issues going on. And I think that's a very commonly missed area that contributes to this problem. But
I totally agree.
Yeah.
And people will come in and their doctors tested their thyroid and everything's normal. And they'll come in and they're on a medication called Synthroid or levothyroxine. Of course, now their thyroid is being treated. How do you figure it out from there?
Well, we look at certainly symptoms. We look at body temperature. That's a great indicator for how the thyroid is working. We look for the presence of antibodies against the thyroid. There are a couple different antibodies that we look at. And then our laboratory tests, the numbers that we look at that tell us the thyroid is working well or not, there are much stricter criteria. And so looking at all of those things, we get a much clearer idea of how well or not so well the thyroid is working.
Yeah, I totally agree. We run the same lab tests, and I tell people, just to suggest to them, because sometimes you just need those extra words to help get through, and it's like, well, how do your fingernails grow? Oh, my fingernails, they don't grow, they chip and crack. How dry is your skin? Oh, it's not dry, I put lotion on it every day.
Yeah.
Those are the things that mean you've got a low thyroid response, and sometimes you have antibodies your doctor didn't test for, just like you mentioned, that are eating some of the thyroid medicine. Sometimes your receptors don't work. There's so many things. You don't need a lab test to show your thyroid's low if your body's already told you by your fingernails and by your skin and so forth and so on. So thyroid's a great one. Hormone imbalance. That's also really, really important. Can you talk a little bit about that?
Sure. For most of us, as we age, along with other factors, and what we're really talking about here are the sex hormones. Those hormone levels begin to decline. They fall out of balance, and they also don't work as efficiently as they used to. Our body doesn't work, in single units. It works as a whole machine with different parts working together, and our sex hormones are no different. It requires other parts of the body doing its job in order for those hormones to work. And so we'll look closely at the lab tests along with symptoms. We'll look for imbalance, especially in women, and maybe you want to talk a little bit more about this, but in women who come in, even women who are coming in before the menopause, maybe perimenopausal, we see a lot of imbalance, especially estrogen to progesterone levels. Testosterone levels can be low. And so we focus a lot on that area with our female patients especially.
And those things lead to fatigue, and they lead to not being motivated to get things done. So very, very important. Let's move on and talk about toxicology, the poisons that people get exposed to, and how do we find out about that?
Yeah, so there's a variety of testing that we can do. We can look for the presence of heavy metals. That's a very common cause for toxic issues. There's a number of ways to do those studies. But first and foremost, you have to identify what the toxic agent is, or toxic agents. A lot of times it's more than one, and then figure out how to remove that, how to eliminate the person from being further.
We really have to also, we not only have to get it out of their body, we have to minimize their exposure.
Correct.
We have to get them out of the exposure they're in, and sometimes that exposure can come from things that are already in your body. Sometimes that exposure comes from outside. And so, yeah, that is a very important one. Let's speak a little bit about food. I teach people that your body is somewhat like a high-performance biochemical Ferrari. And if you're driving a Ferrari and you decide to go to the track and you stop on the way at the local gas station and put in 87 octane, the car's not going to go around the circle as fast as if you put in 100 octane racing fuel.
You know, food can be a medicine that helps our body function optimally, or it can be a poison. It can be a toxic product. And I think in the United States, and even in most Western cultures, we have a plethora of food, but the food that we have is nutritionally poor. We get a lot of calories, but very low nutrition. The soils that we grow food in is depleted. The growing practices are all about high yields, but there's not a focus on the nutritional quality of the food that we're growing. We also get into the realm of processed foods, and that just totally depletes and destroys the nutritional value of what we're consuming.
So we're eating food that doesn't give our bodies what it needs. That's, a really bad thing for trying to get the most out of what you've got. And we've found people so sensitive. We publish an inflammatory food list on our website, and the tolerance I've seen for people with chronic fatigue for even small amounts, even a small amount of bread flour, for example, it can bring on fatigue or bring it back when it's on its way out just a little bit, and that extra fatigue can last a few weeks just from the food.
Yes, it's pretty common when you talk to patients about their diet, that common response, and I've seen you get it in your office, and I certainly see it in mine. You ask someone how well they're doing eliminating a certain food, and they say, "Well, I'm pretty good." I think your famous saying with that is, "There's no partial credit in this," and that's true. Yeah.
Especially with chronic fatigue, when your system is down for the count, and you've really lost so much resilience that you're in that kind of shape, it's really much more difficult for you to recover. You don't get away with the things that you might think you get away with.
Yeah.
All right, let's move on. Let's talk about adrenal glands. We mentioned thyroid, we mentioned hormones for the sex hormones. We've already kind of alluded to the idea that the endocrine system is highly involved in this chronic fatigue symptom thing. Let's talk about the adrenal glands.
Yeah, adrenal fatigue is, I'll bet 1 out of 3, 1 out of 4 patients that we see have some element of adrenal fatigue, and it's probably higher than that. But your adrenals are really important in a lot of functions of the body, healing, repair, energy, and others. And when your adrenals are tired, just like our muscles, when we overuse our muscles get tired. Our adrenal glands are no different. We overstimulate the adrenals more often by our lifestyle, lack of sleep, burning the candle at both ends, poor diet, lack of exercise, emotional stress, and the adrenals just get tired and they fail to produce the hormones that they're supposed to produce.
And one of the things that is involved in this field is that they've worked so hard for so long, they get so fatigued, your get up and go has got up and went. And so how do we figure it out?
Well, again, I think it goes back to a good history. Asking the patient about how they're feeling, the symptoms, the duration, going back. Oftentimes we have to go back years in the patient's history to see this kind of timeline of how their symptoms and health has changed over time. There are tests
I see a lot of times people remember that they burned the candle at both ends for many years, and then when their body started to not want to do it anymore, they kind of whipped the dead horse and
fed at caffeine and 5-hour energy drinks and all those things, and eventually at the end of the day, the body just can't sustain, and then they're down for the count. And real chronic fatigue, you're down in a big way. You get up in the morning, you might shower, and then you've used up your energy for the day, and you're going back to bed. And people look at you and they say, well, just get out and do it. Just do a little bit of exercise. And anytime you push yourself, your body pushes you back and steps on you, because you don't get away with that. You don't have the tolerance to handle that. And people find that their wall is really firm.
Yeah, there's a patient who comes to mind with this. Every time I talk about this, I think of this gentleman. He worked as a courier, and he was working out of state, had an opportunity to work a lot of hours and make a lot of money doing what he does. And as he was doing that for months and months in a row, he got a call that his mom was sick. He had to come back to Ohio. Unfortunately, she passed away. And that event, coupled with the fact that he had been working so many hours for so long, caused him to crash. And really his adrenals gave out. Unfortunately, he sought out care in traditional medicine, and they put him on opioid painkillers and medicine for anxiety, and that led to a problem with being hooked on those medications. He developed a dependency. And so by the time he saw me, we had years of dependency on medications, and the adrenals were burnt out, and he's doing much better, but he's still got a long way to go. And so I think the take-home message is for people to understand that how they're feeling, what their body is telling them, are important cues, and they really need to seek out care from qualified professionals who can help them, and not just put a Band-Aid on the problem with a pharmaceutical agent.
And I think to that end, the real treatment here is not generally known by the average medical professional. The average nurse has no idea. The average doctor has no idea. But let's go on. We have a couple more things. Sick. A lot of people get fatigued when they're sick, and a lot of people don't know how sick they are.
Yeah. Chronic fatigue syndrome, one of the most common triggers for it is when we get an infection and quote-unquote recover from that infection, but we still feel tired, exhausted, worn out, depressed. We have aches and pains that we didn't have prior. And so there's something obviously going on even after we've recovered from whatever infection it was that attacked us. People oftentimes think of Lyme's disease in terms of post-chronic fatigue syndrome after an infection, and that's certainly very common. I think it's often not identified as often as it should be. Yep.
Another one is continued mold exposure, and what that's like. So many things need to be investigated, and then there's the more common things that more people know about, like Epstein-Barr virus and cytomegalovirus and herpes sticks infections, and they can be tested for by we write a prescription, you go to the lab that you've always gone to, and those things can be investigated. So some of these are easier to find, some of these are more difficult to find, and depending on how your body and history and so forth have gone, gives us clues as to what to test for, but those things are also seriously on the list. Now we have COVID.
Right.
That gets to muddy the waters quite a bit.
It sure does. And we're actually seeing people who have become infected with COVID that go into a chronic phase. The heart muscle is affected. The lungs don't function as well as they should. There's some fibrosis that occurs in the lungs of people with COVID. And so that brings in a whole new realm of issues to deal with.
One I didn't think of, and it wasn't even on the list, is medication. Prescribed medication by well-meaning physicians that have either antibiotics that have wiped out your gut flora or dramatically changed it. That is part of this fatigue. Or medicines that have taken away your coenzyme Q10 to reduce your cholesterol. And how many people have muscle fatigue? And heart's a muscle. It's going to have fatigue there too. Brain is actually a muscle. Your parents weren't joking when they told you to exercise it. So, we should at least pass over the idea that there's medications that are commonly prescribed that can be easily part of anyone's chronic fatigue.
I think that's a great point. And I think we tend to take those points for granted, but I think the average person who might be listening to this conversation, they don't necessarily think right away that the list of 8 or 9 medications that their doctor has put them on over the years might be actually making them feel sick.
And there are common medications that you could possibly even just Google and look up that deplete your B vitamins. And here you are taking your medicine, your B vitamins are, really depleted, and that's your energy system.
Yeah, you brought up a great point with antibiotics destroying good, healthy bacteria. We talk so often about the importance of the gut and how the gut really helps regulate all other body function. Even the brain is told what to do in some degree by the gut. And so when we take antibiotics for every sniffle or ailment that we call the doctor for, we're just destroying those healthy, beneficial bacteria that are giving guidance to the rest of the body to work the way that it's supposed to. So, great point on that.
Very few of us really realize, and it is becoming much more in vogue to understand that we are not the only ones living in our body.
Yes.
And we've got good guys and bad guys, and part of the name of the game in even treating, maybe especially treating chronic fatigue, is to stop feeding the bad guys and encourage the good guys and encourage the biodiversity. The more different kinds of critters you have, the better off you are. We have one more on our list before we close for the day, and that is energy production. Here we are, as we get older, we have thousands of energy factories in every cell in our body. We call them mitochondria. We do all kinds of things to stress them out, make them function less, and sometimes you're a 40-year-old person walking around with 60-year-old mitochondria because you've been taking medicines that make them not work, you've been putting heavy metals in your body just by walking around out in your yard that fall down from the sky, and then you walk inside your house with your outdoor shoes on. All these things affect your mitochondria. Let's talk about that a little bit.
Yeah, this is actually one of my favorite topics to talk about, because everything else that we've been really discussing eventually has an effect negatively on the mitochondria. That's, we call the mitochondria the powerhouse of the cell. It's where our energy comes from. And if you look at the conversations being had in science and medicine, there really are two camps. One side who sees disease and illness as more of a genetically related issue, and then on the other side of the other camp are those who view disease and illness in terms of mitochondrial dysfunction. And unfortunately, we've kind of have this battle taking place in science between those two camps. I think you and I both tend to fall more on the side of most disease comes from mitochondrial dysfunction, and that can lead to genes being turned on or turned off, which is definitely a much more hopeful concept because we can change mitochondrial disease. The folks on the side who believe this is more genetics, you're just born with it, well, there's not much hope for change with that philosophy.
That philosophy about genetics really people need to understand, and they need to hear, and many of them haven't. 91% of our genetic structure is changeable by what we eat.
So if you think that your genetic structure dooms you to something, you can change 91% of that, because you turn genes on and turn genes off by what you eat, by what's called substrate, what the genes are going to act on. And so a lot of this treatment and healing is all about exploiting the knowledge of that and helping your body get it right. We also, and one of the most fascinating things to look up is ozone therapies.
Yeah.
One of the best ways to quickly rejuvenate someone's mitochondrial function is ozonated oxygen treatments, which anybody can go and look up. There's lots to read about it. And you can see why there are claims on the internet that it can help almost anything. Because like what you said, at the basis of a lot of disease and illness is the mitochondria are tired, the cells can't do their job, and so you're sick and fatigued because you can't work on your insides can't work. Your outsides look really good, but your insides are really tired. And this is a way, and if you can untire and recharge your mitochondrial function, most any illness you have, your immune system will work better, your brain will work better, your blood will deliver oxygen better, most anything you do will work better. So people who are fortunate enough to have exposure to that have a really good tool.
Yeah, I think an important point to that is that ozone therapy is really backed up by research and science. We can look at the health of the mitochondria, test called the telomere analysis. We can look at the length of their telomere and really get an idea of their mitochondrial health. And when you look at folks who have received ozone therapy, we see improvement in telomere length. So there's actually science to back that up.
There's a lot of really fascinating science. There's a doctor named Schallenberger who's done some wonderful research about putting people on a bicycle and then measuring the gases going in and out of their body and measuring how long does it take to switch from aerobic to anaerobic metabolism, and now all of a sudden you're making a lot of lactic acid in your muscles. So, which also you now have to work on, that your body has to expend energy for to recover from the exercise that you had, and that's also turns out to be chronic fatigue. So if you can delay anaerobic metabolism and burn fuel in the presence of oxygen longer, you're much more efficient in your energy production and much less toxic from metabolic waste that your body now has to deal with.
Great point.
Well, I think we've covered this pretty well. We've given people a real good introduction to maybe not exactly how to treat it, because that is a lot and a long debate. But we've really introduced how to think about it, how to consider it, where to even start to go, so that you can start to ask the doctor that you're seeing, what about this doc? What about that doc? And then do your own research, and because you are your best inner physician, you are your best inner guide. If you don't take an active part in your healthcare and you just depend on the medical consultants that you're seeing to know and have all the answers, well, you're working at a deficit, and you could really participate and get a whole lot more for what you're doing just by that participation.
I think that's a great point and a great place to maybe wrap this up. I think what's very clear from the conversation is that this issue of chronic fatigue and so many of the other symptoms that are often affiliated with that condition, it's a very complex problem. And the average 4.5 minute doctor's visit is not going to be sufficient to even begin to scratch the surface. And if you aren't your own advocate, if you don't advocate for yourself as a patient, no one else is going to advocate for you. So it has to start there.
And We mentioned lots of things that contribute to this chronic fatigue. If you handle 3 of them in your treatment program and you miss the other ones and you're not getting better, it's maybe because your system's lost enough resilience that you need to do all of it. And maybe there's ones we haven't mentioned yet that other people will come to, because there's all kinds of mind, body, spirit pieces that are also in this. You mentioned that the gut drives the brain, or the brain drives the rest of the body also, so there's such an integrated system. Don't think that if you've done part of this and you're not better, that that's enough. If you're still eating something on the inflammatory food list and you've done everything else on here, that might be all it takes to keep you miserable. Well, folks, we hope you've gained some really wonderful insights into how we think of chronic fatigue syndrome. I'm Hal Blattman, Medical Director of the Blattman Health and Wellness Center, and you are?
Clint Cornell, Physician Assistant with Next Direct and Health Educator. We're both here because we want you to be informed, we want you to be empowered, and we want you to achieve a higher level of health and wellness. Thanks for joining us.
Have a good day. We'll see you next time. Bye now.
Good morning and welcome. I'm Dr. Hal Blattman. I'm here today with
Shauna Elbisser. How are you?
And Shauna and I, we've worked together for a number of years. Shauna's a nurse, very familiar with pain. We're going to have a discussion today about pelvic pain. And welcome to you, and hope you enjoy this and learn from it. We were just talking just a couple minutes ago about how pelvic pain starts at childbirth.
Yes. If you get to go the natural route, whether you have the epidural or not, there is pain that you will feel hours to days and even weeks, months, and years later.
And some women have pain for years after childbirth and attribute that pain to the childbirth injury. Some women don't develop pelvic pain till they're teenagers, and it's menstrual cramps and menstrual pain. So we can talk about that. And then we have pelvic pain that maybe starts with childbirth, maybe doesn't start with childbirth, but has something to do with injuries that happen in other ways. We start to injure our thighs and our pelvis when we start jumping down the steps as children. When we bicycle, when we run, when we land in an unfortunate way on the parallel bars or I-beam or however that goes. What kind of injuries do you see, Shauna, when you think about pelvic pain?
Personal experiences, you did mention a couple, those misfortunate slips off the bicycle. I remember when you said jumping down the stairs, some folks jump up the stairs as an exercise. My oldest was just doing that yesterday while I was at work. He was, just jumping up the stairs while I was cleaning up, and he kind of tumbled back. I would say probably my biggest sources of injury to my bottom outside of having 4 babies would have been, I spent many, many weekends roller skating and falling on my bottom on the on the roller rink floor.
And I didn't even mention falling on your tailbone pain. That's a big one too. So, when women and men, because this is both, have pelvic pain, men often get diagnosed as prostatitis. Women often get diagnosed as interstitial cystitis, because sometimes it starts with burning when we urinate. What are some of the other diagnostic words that get jumbled into this pelvic pain mess?
I would say a lot of times, honestly, doctors sometimes just kind of even write it off. I mean, if I'm talking about like from an internal hospital standpoint, unless they can actually like pinpoint a diagnosis that they can intervene with, they usually just, push that patient to go see someone, some specialist outside, whether it's a female doctor or a pain doctor. But, you see things, especially with, certain other diagnoses or reasons people come to the hospital. They might, say, oh, well, you have pelvic inflammatory disease, or trying to think.
Pelvic inflammatory disease, while you bring that up, that actually was my start in the whole concept of pelvic pain. I was working in this clinic, and it was a Sunday morning, and this woman came in with pelvic pain. And her story didn't fit, but her physical exam was intense pelvic tenderness. And everything in my book said this is a pelvic inflammatory disease. Intravenous gets started, ambulance gets called, and you're on your way to the hospital. But her story didn't fit, and she was about, 15, 20 years my senior, and I looked like Dookie Howser in those days. So I looked at her, and I always scratch my head, and if I had overalls, I'd adjust them too, whenever things really don't fit. And I said, instead of a pelvic exam and starting an IV and calling the ambulance, do you mind if we just stretch out the muscles in your belly? And I had been given a monograph, 30-some pages, by Dr. Janet Travell a few weeks before by a medical director of the urgent care I was working for. And I went into the book bag, my little office there, and I opened this thing up and turned to the page on pelvic pain. And it had diagrams of how to stretch a person out and a diagram of what the pain pattern should look like. And so I laid that out on the table, and she got up on the exam table, and I'm like looking at the pictures because I've never done this before. And I'm moving her body like what the arrows said on the pictures. It took about 5 minutes, and all of her pain was gone. And this abdomen that was extremely tender, especially below the belly button, was totally nothing. Soft, not tender. Now I'm really scratching my head and adjusting my overalls. I'd never seen anything like this before. And I don't believe anything I can't touch and feel. So I got permission to call her back in a week. I called her back in a week. The pain was still gone. So I read the rest of the article. And I learned that every muscle in the body can generate a pain pattern. And then as you and I were working together, we came across the idea that, well, maybe all of our pain comes from that. And indeed, 80% of the information that comes to our brain from our periphery, arms, legs, whatever's outside of the brain, 80% of that information comes from nerve endings in between the cords, strings of fascia that go through our body and hold it together. The nerve endings in between these strings provide 80% of the information that comes to our brain. And most of what's in pain is the distortion in our fascia that those nerve endings pick up. And how do we find those in our patients?
Well, you have to do a thorough physical exam.
Right.
Where you always differentiated that from other orthopedics or, doctors that I've worked with over the years is you don't just look at how the body moves and focus on your joints and, a painful nerve test. You actually, touch the body, touch the muscle, touch the fascia, and see where those individuals actually experience the most pain based on where, you're touching.
Exactly. So what we learned as we were working together is that you can't believe what you feel. You really can only believe where you're tender. And so for the person in pelvic pain, if we're looking to find the source of the pain, after you know about your bladder, after you know about whether you have a fractured tailbone and other things like that, the next step is to find out where you're tender. And a lot of folks with pelvic pain, their tenderness is going to be the muscles on the inside of their thighs, the muscles on their buttocks, and the areas where those muscles attach. So we teach, or we started to make an analogy so everybody can touch their neck. And so if you try yourself, you can grab hold of this big muscle that runs right down here in the front of your neck, get a big bite of it, and most everybody can feel as they come across this muscle that there's tight, ropey, tender ropes inside that muscle. And you also can feel that some of them, somewhere along this line, are way more tender than you ever expected them to be. Well, those kinks in these diagrams, like the one I had with that pelvic pain person way back when, make this pain pattern. And how did you get these? Feel the top of your collarbone, not the front, but push in on your neck muscle and feel and push down on the top, and you'll feel these differences in texture that are also surprisingly tender. And this is the injury that causes that. How'd you get this injury? It might have been nursery school when somebody came up behind you and pushed you down and shoved your neck back and tore, where these collagen fibers attach and weave to the cover over this bone. And you wear that around now, remnants of that injury with this tenderness and these ropey bands. Same thing happens in the pelvis. Where do we find them, Shauna? I'm going to find the picture while you talk.
So if we're talking about where we would, touch on those, well, one, you do begin to squeeze those inner thigh muscles, and then you can, generally those are tender for individuals that are complaining of that severe pelvic or, lower abdominal pain. But also, just feeling around, your pubic bones and even around like the buttocks, kind of working your way up to, your rectum. You generally, you can feel that just intense, you're feeling the changes in the muscle and the fascia, and the patient saying, yes, that's exactly where it hurts.
And here's a diagram that we refer to, this one right up here in the corner, how the muscle that we call adductors on the inside of the thigh send pain that to us is going to feel like it's in our bladder or feel like it's in our prostate. And then the muscles that you were just talking about, that's everything that attaches to these bones of the pelvic floor. And just like this clavicle was tender, you need to go down, feel your pubic symphysis, and feel those bones as they go back toward your sit bone. And if those are tender, those are the attachments, just like this, that were injured when you landed jumping down the stairs, or when you landed off your bicycle, or God knows what other, or the tear from the inside during delivery and childbirth. And men, except for the childbirth thing, it's not any different. Only oftentimes we don't get the bladder symptoms, we get things that we attribute to prostate. And so, if you've been working on this for a long time, and you've had pain for a long time, and your pelvic floor therapist is helpful, and every time you get your muscles stretched out, your pain gets better, and then it keeps coming back. So really, you end up in this cycle of how do you survive, right? And you go in between your therapy appointments, and they get you back in shape so that you can go and wait another couple weeks till the pain's bad enough to go get some more treatment. And what needs to happen is that these knots and cords in your muscles need to be more ignorable. And these injuries where you hold together, your body needs to repair them. And the problem is that your body has no idea that it didn't repair you the first time, and the second time, and the 100th time. But if you're still tender, that means your body didn't repair you enough. And just like this is tender and perhaps you have no clue, there are other parts in your body that are tender that you have no clue about. So when you go to heal the wounds that have given you a lifetime of pelvic pain, it's not about being 100% perfect and 100% restored. Really, all you need to do is restore everything to where it's 99% ignorable, just like this, and just like other places in your body that would be tender, but you don't actually walk around with them. So, Shauna, let's just talk for 2 or 3 minutes before we end. Give folks an idea of how do we make it go away once we find out where you're tender and we find out where the pain comes from. How do we get your body to heal?
Well, there's, it's kind of a multi-layered experience. There's, the greatest success when you take all of the knowledge and the science that we, Dr. Blattman would give you as far as, ways not only that you can heal that pain, whether we're using regenerative medicine like PRPs and other like stem cell factors that can help your body actually heal and know that it did it incompletely. We create a small new injury and place those those parts there so that it can kind of give your body a little bit of assist in building new healthy, anchoring fascia, things of that nature. But also, if you want to get it ignorable, you have to take into account that this means you can't have Mountain Dew and you can't smoke your cigarettes because those are, toxic to our bodies, and it's going to create just an overall general higher level of inflammation. So if you already have those injuries, you're just going to put the spotlight on it when you pack your body full of bad food. Your body
Exactly. And that's so important. There's a few basic things that need to happen for a person to heal. The physical trauma and the engineering failures of our body to hold itself together from those traumas, that's mostly ignored because you go to your doctor and you're going to get a drug and medicine to help make your brain ignore all these injuries. And then you need to change your food, change what the environmental toxins and poisons are doing to you, and all those parts are part of your biology to try and restore itself. And so if you're really going to work on this pain, all of that needs to be taken into account. And then God knows what's been going on in your head for the last how many years that you've had this pain. Can't ignore mind, body, spirit, and what goes on with that. So we look at a whole biologic restoration to deal with all these facets of pain. But most important, and really what I think is most important, is the physical injuries that nobody else has identified and nobody really knows how to heal, that your body can't heal by itself and needs extra help for. Well, do you have anything to say in closing, Shauna?
Well, just one small part. You say that the doctors will give you medicine and things like that to make you kind of ignore it. I've not met one chronic pain person that just with traditional treatment is ever pain-free. There's no amount that we can give. We increase their Neurontin, we increase their pain medicine to maybe a different type or maybe to a type of patch. And then eventually we get to a point where their bodies and they can't handle it, whether it's age or some other change. So really, people can tend to get a little overwhelmed with the idea of, I've got to cut all of this stuff out of my diet or my lifestyle, but it really is the best shot you've got, and it's in your hands, because there's a certain point where the doctors are like, that's it, I give up, there's nothing else I can do, this is just kind of where you're gonna have to settle. And don't settle for pain.
And when they get to the point where it's time to settle, usually that next step is surgery to deal with a nerve that we think is causing the pain. And I really want to underscore that. If you think your pain is pudendal neuralgia, if you think your pain is coming from a nerve, as long as these muscles are tender, as long as these attachments to where the bones are tender, there is no way you can convince me that it's coming from a nerve, and you shouldn't be able to convince yourself. Your real answer is to make the things that are tender less tender, so you can ignore them also, and realize that they create collectively, all these injuries create a pain pattern in your body, and you need to eliminate enough of that so that the collective becomes ignorable. All right, Hal Blattman, Dr. Hal Blattman, based in Cincinnati, Ohio, offices in Manhattan, and I'm here with Shauna Elbiser. Shauna, tell us just a little bit about yourself.
So I've been a nurse for a little over 10 years now. I've worked in specialty surgeries, like transplant at University of Cincinnati Hospital for almost 5 years. Then I came to work with Hal for about 3 years. I went back into acute care medicine because I had learned all of this information. I was like, man, these are the people that need it. So I worked in the float pool for the St. Elizabeth hospitals in Northern Kentucky. And then last fall, I started teaching high school for the Ignite Institute in their pre-nursing college pathway. And I still, I love nursing. I'm meant to be a nurse, and I don't think I can teach nursing without still having my hands in it. So I still work at one of the St. Elizabeth hospitals. I'm on the pulmonology unit in Edgewood, which quickly becomes the roll-out COVID unit. So, and anything else that, we do a lot of wounds actually. So you get a lot of the folks that have these wounds, either as a diabetic ulcer or a vascular ulcer, and then all the pain that comes with those, and the amputations and things of that nature. So, yeah, that's where I spend my time.
Well, thanks very much for joining with us today, and have a wonderful day, and we'll talk next time.
My pleasure. Take care.
Bye now. Hello, everybody. Today, we're going to talk about headache, what they are, how to make them go away, and we're also going to talk about New Year's resolutions. Is it something that's important? Is it something we should be doing? Is it something that's even helpful or even useful? And I'm here today with
Jen Beck.
Say good morning. Tell us a little bit about yourself.
Sure, good morning. My name is Jen Beck. I'm a registered nutrition consultant and a certified lift practitioner. I own Complete Health Revolution, and we help you to reclaim your health and recharge your life by figuring out what you need to be eating and also what's eating you, so that you can create lasting habits and lasting change. We're also here in Cincinnati.
And you see people with headaches.
I do.
And we all have some success in helping people make them go away. What do you find is most important from the pieces that you add to the puzzle?
For me, it's always about starting at the fundamentals and starting people with small, basic changes. And one of the most important things that I see beneficial for many people, especially with headaches, is water. It's the simplest thing, and it's so simple to do, and yet it's so simple to forget about too. But just hydration is massively beneficial for helping people to diminish headaches.
I have a friend who says you should be sitting all day long with a thing of water next to you. Every time you see it and look at it, you should be taking a sip. And every time you empty it, you should refill it and repeat the process all day long.
I would completely agree. Hence my 32-ounce glass.
People not only not drink the water, they drink so many things that are counterproductive.
Right.
The possibility of health. Soda is not something we should be drinking. Fruit juice is not something to be drinking.
No.
All right, well, we'll get back to that. Let's talk about headaches, where else they come from. Headaches don't come from your head. That's probably the first thing people really need to learn. We go to the neurologist, we go to the head doctor, we go to the spine doctor. They tell us all kinds of things, but the headache generally does not come from your head. We were taught as doctors it comes from the blood vessels in your head and in your neck. maybe because you can feel it pounding. That's really not true either. What you're going to find is that pain in your body comes from the places that are tender. So, where are the things that are tender that cause headache? Jen, you know some of these, right? In your neck and shoulders and upper back?
Yeah.
So, here's one way to find them. There's a muscle right here along the front and side of your neck. It's a really big, kind of thick muscle. Take that, and you can grab hold of this muscle. You can pinch it between your index finger and your thumb, and you can feel that within this muscle, there's ropey, tight bands, ropey, tight cords in this muscle. Well, the places where these are tight and the places where these are most tender, that can generate headache. And the diagrams have been around for a long time, and that's this one, right here in the front center of your screen. And these X's represent the ropey, tight bands, cords, where the nerves in that muscle are really being pinched by the muscle. And then those red speckles that send the pain up this way are where the pain goes. And if you take this muscle and you maintain pressure on it, and you continue to hold pressure on it, you'll actually feel that pain pattern if this muscle is sensitive enough. Well, where does the injury come from that causes this? Now push in a different place on your body. Go ahead and push right on the top of your collarbone. Not on the front, but push in and then push down against the top, right here toward the middle. And you're going to find there's little lumpy areas, difference in texture that isn't quite smooth, and they're surprisingly tender. And these are the injuries that cause this to happen in your muscle. And just like this muscle causes this headache pain pattern, you'll also find there's other muscles in your neck, your upper shoulders, and these are the areas that contribute to the orchestra of injuries in your body that contribute to the pain you identify as a headache. If you can make all these kinks or knots in your fascia cords and strings smooth out and go away, and if you need to make these injured areas from way back in your childhood heal and help them get better, that's how you make the headache go away. But what glues this together is what we need to talk about in resolutions, right? Or what we need to talk about in how to change our body and how we think about it, because what glues this together and what lights up this injury from many injuries in your lifetime, lights this up kind of like plugging it into a socket, that's the food that you eat that you don't even know is causing your pain. So we're going to talk a little bit about that, and then we're going to talk about how do we make those changes, and our New Year's resolutions, even should they be in the game, are they important, do they work? So let's talk first about which foods cause most of the pain and especially headaches. What do you find, Jen?
So through working with clients, I would say that dairy, gluten, sugar, for some people grains, for some people eggs and soy are some of the major ones.
I will totally agree with that. And so I find that these muscles in your upper shoulders, they can be tight and they don't have to be tender. If these muscles are tight and tender and you have not yet taken dairy, gluten, and sugar and artificial sweeteners out of your diet, you're really missing out. And you're not even knowing how much of that can be causing this pain. And don't you owe it to yourself the curiosity to find out if taking these out of your diet really makes a difference? And most often you have to take out the trifecta. You can start with just one, and usually the one you start with is the one that's least painful, because the ones that are more painful are the ones you think you're bound to and you want to use all the time. But really, if you take one out and you're not better, don't say that didn't work. You still need to take the other ones out.
Yeah, I think that's a big point, Hal, because I think there's a lot of people that go gluten-free or they go dairy-free and they're like, well, that didn't do any good, without realizing that it's the combination of factors. I mean, some people occasionally, like I have people that they can eat bread and then they can eat cheese, but if they put it together, it's disastrous. Not understanding that there's inflammation caused by each one all the time, it's just amplified when you have multiple things in your body at the same time.
And it's not like 1 and 1 makes 2. It's like 1 and 1 makes 6.
Yeah.
And then there's the other issue right along parallel with that of people going, well, I'm mostly gluten-free. I only have a little bit of cheese. Maybe I only put a little bit of butter with my... What do you say to that?
Well, so you can have a little bit of arsenic too. Do you want that?
Very good point. You can have just a little bit of pregnancy. You're still pregnant.
Right.
Right? You don't get a little bit. So, and I talk to people about how this is an effect on your immune system, right? This isn't just talking to your headache. And what if your immune system was sensitive to the sting of a bee, right? There's people pretty allergic to bee stings. How many bees does it take to kill you?
1.
Yeah, or even less than that. What if the bee only partly gets you? It's like half a bee, you're still done for. Or what if you're the person on the airplane and somebody opens a bag of peanuts? They now tell you when you get on the airplane, sorry, there's somebody on here today with a peanut allergy. There's be no peanuts and don't open any on your own. I mean, they're pretty vocal about that. So to think that you can get away with a little bit of butter when you're sensitive to dairy, often doesn't work. But how can you tell? What is the timing? Listening to us in this format is wonderful, but if we can teach you as the person how to listen to your body to know what it's telling you, and so what are the signals? How do you teach how to listen to your body?
Well, so for me, when I work with somebody, I actually have them monitor how they're feeling 30 minutes to an hour and a half after they eat. And we're looking at things like pain, digestion, energy, mood, headaches, really anything that is different. And because when you can start creating that correlation to I just ate something and now I feel off, that's a big factor and it's a big awareness. But I always remind people that it can be up to 3 days before you actually see a full reaction from a food you've consumed.
Great point. You're really lucky if you can tell in 2 or 3 hours. You're really lucky if your body is that fine-tuned that you can know. But a lot of people, they don't know till 6, 12 hours later. So what I talk about is, if you wake up in the morning with pain you didn't have last night when you went to bed, and you don't remember falling out of bed or getting hurt during the night, it was something you ate last night that set off your immune system and lit you up.
Can you hold it closer, Hal?
If you go to bed in pain,
there you go.
You didn't have this morning, then it was breakfast or lunch. And that's the way we talk about it. And those are probably the earliest signs, but you're absolutely right. Can be 36 hours. Can be you created the injury by doing some physical activity that strained some muscles. And then you ate something the next day while this injury was still healing, it will light that up. We should be able to repair our small injuries under our radar without our body even telling us. You should be able to go out and do physical activity you're not used to, if it's not over the top, and not be sore the next day like you expected. The reason you're sore is because your body's showing you the injuries you had yesterday that it cannot repair under your radar because of the information from your food that Yuri mentioned in this talk. So let's go to resolutions. You don't like them. Can you talk about that?
Well, I think they set us up for failure. We as Americans have been molded with the diet industry to do all or nothing. And so people go, all right, this is it. This is year I'm going to get healthy. I'm going to go to the gym. I'm not going to eat any more sugar. Carbs are gone. I'm going to have a dry January. I'm not going to drink anymore. Like I'm all in. I'm going to do it. And your brain goes kicking and screaming into activity for a day or 2 or maybe a couple of weeks. But its whole goal is to be able to drive you back or drag you back into the comfort zone. So creating a massive overhaul of your lifestyle like that isn't sustainable because it's too much too soon. Not to mention somebody who hasn't worked out in a year or 2 or even 3 months is going to go to the gym and get sore. And our brain goes, we don't want to be sore.
That's right. I didn't like getting up early. I don't like this whole drill. I think I'll do this for a week.
Yeah. It's like, why bother? And right. Well, and they say that, what is it, like 64% of all New Year's resolutions are done by the second week in February, if not sooner. Like that's the 64% at least are done.
Because those people are successful and accomplished every goal they set out for?
Right. No, because they're overwhelmed. They beat themselves up. They've got cravings. They haven't fully committed to the full picture, and they have a life outside of their health. And so what I teach is how to create a lifestyle, so it's small, sustainable changes. So you're layering success on top of success on top of success. So your brain goes, this is uncomfortable, but we didn't die. We actually feel kind of good. Okay, what's next?
Yeah, and I think that if you make the changes with the same level of discomfort, if you keep pushing your envelope with the same level of discomfort, you get where you need to go.
Mm-hmm.
You know, maybe the first change has a level of discomfort, and don't rest on that. You accomplished that, you've made it happen. Now take the next change. Don't take anything bigger than the first one. But now, like, you couldn't have taken those two at once, but you could take them now one at a time. And then don't rest on your laurels. When you're comfortable with that one, it's time to make the next one. And that actually is possible. You kind of do the same thing, right?
Yeah, it's about baby steps, right? So when I work with a client, we set 3 baby steps that are a stretch, but that they know for a fact that they can do, no matter what. Right? Because we've got to get our brain on board. Water is a really big place to start, because most people are chronically dehydrated in America. And so getting them to drink half their body weight in ounces of water per day is kind of a minimum. But some people, like I have one gal, she was drinking 240 ounces of coffee a day and 1 bottle of water every week or 2. I mean, she was on coffee 24/7. She was doing laxatives because she didn't have the ability to have a bowel movement without them. And so I talked to her about water, and she's like, okay, so if I've got to do that, and for me, really looking at how do we compensate for the other things that we're drinking, right? Like diuretics. Coffee's a diuretic, so it pulls the water out of our body, or pushes the water out of our body. So, it should compensate for every cup of coffee you have with 2 more glasses of water. So if that was the case,
a bathroom a lot.
Absolutely, right? So 240 ounces times 2, that's 480. She was about 200 pounds. So that's another, so she's at like 560 ounces of water a day based on just what she was drinking in coffee. Not going to happen.
560 ounces, that's how many gallons?
About 4.
That's a lot.
It is. And never would I tell somebody to drink 4 gallons of water in a day. You flush out all your electrolytes and everything else.
Right.
But the goal is to be able to make small changes. So for her, it was the gallon challenge, right? You don't have to give up your coffee, but start drinking a gallon of water a day. It's 4 of these, right? And when she started drinking more water first thing in the morning, she didn't need the coffee. Shocking. She needed a little bit just to be able to take the edge off the headache because she had caffeine withdrawals. But that lasted about 3 or 4 days, and then she was drinking a gallon of water a day and felt amazing.
And the same thing happens with food. You miss it at first, but you start to find a week later that you feel better. If you're a chronic pain patient and you've been taking pain drugs, you're going to find that they start to work better.
Yeah.
And then you find out, when you were a child and you did something mama told you not to do, didn't you get smacked upside the head at least a little bit? And, some people say, no, my mother never did that. And I look at them and go, well, your body's teaching you what your mother didn't teach you when you were a child. Now, every time you do something your body asked you not to do, your body smacks you upside the head and sends you to your room. Now that's a headache. It's your back pain just got worse. It's you picked up a Kleenex and you thought you threw your back out, but it wasn't the Kleenex. It's the inflammation from a tweak you did in your strings as you picked it up that would have never happened had you not eaten what you ate yesterday.
Yeah.
Yeah. So
totally agree.
Learning how to do that is so, so important. And when we use our injection techniques and we take all the tenderness and all the hardness out of this muscle and make it soft like a baby's muscle, so to speak, if you glue this back together and your pain comes back in 2 days, it's almost always your food. So take that out now before you come and see us and see how much better you are. And then when we do body work on you and do loosen you up, you stay loose for a lot longer. It's a whole lot more fun. All right, we want to open this up for questions. But before we get to that, I want to just take just a minute. We decided at the Blattman Health and Wellness Center, just in the last few weeks, we're going to put on a program the first Saturday in February, right before, a week before Valentine's Day. 6 hours talking to people about what food do you need to change, how do you do it, how is your body put together, what is your anatomy really like, and then how to help you make your headaches go away, your neck pain go away, lower back pain, foot pain, and carpal tunnel syndrome. We're going to talk about all of them over the period of 6 hours. There'll be an admission price. Look for information on our website. Look for information online, and we'll be glad to talk about that very, very soon. And right now, let's open this up for questions. If you have a question to ask for me or Jen, please unmute your microphone and speak up, or make it on the chat piece. And I hope this is loud enough, and thank you very much for the suggestions to do that. Are there any questions? Yeah, go ahead.
I've got a question. First of all, thank you very much, both of you. My screen wasn't showing you at first, Dr. Blattman. Could you show which muscle you were talking about?
Yeah, this muscle right here in the front and side of your neck that comes down and attaches on the top of your collarbone, that you can grab this way.
Perfect. Thank you.
And this makes this pain pattern that goes across your head and is often part of migraine and also trigeminal neuralgia, so-called pain, and also so-called TMJ pain sometimes.
Sweet.
All right. Well, thanks everybody for attending and listening. Jen, thank you very much. Do you have any last words to say? Hello?
Just remember baby steps. Instead of New Year's resolution, set a New Year's intention. What kind of health do you want to have in 2021? What do you want to create? What are the first steps that you can be able to take? And then just keep making new changes, going in the same direction. So think about going from here to LA, right? You can be able to go in a straight line, or you can take 1,001, potty stops. As long as you keep going, you'll eventually get there. So set your intention of where you want to go, what you want to create, and keep moving that direction.
Point yourself toward the star of light, aim for that beacon, and have a wonderful day.
Yeah. Hey, Hal, we've got one question from Katie. She was asking about foods. So the biggest food contributors were dairy, gluten, and sugar, artificial sweeteners, for some people eggs, for some people soy. I've also seen a lot of people with MSG and even some food colorings. So it really depends on the person, but the big ones are soy, gluten, and dairy, and sugar.
And don't forget about fake fat.
Yeah.
Cool Whip, Miracle Whip, Crisco, vegetable oil, margarine.
Margarine.
Not your friend. All right. Bye, everybody. Have a wonderful day.
Bye, guys.
Be sure to take advantage of our current sale. Get 25% off of all of our IV therapy treatments in the month of February. Hydrate and heal faster and give your immune system a boost after the long winter cold. Try one of our many IV solutions, including vitamin C, Myers cocktail, mistletoe, and more. IV therapy is great for those suffering from fatigue, recovering from chemotherapy, have frequent migraines, and many other conditions. This is a limited time offer. Book now while supplies last. See the front desk for more details.
Hi there. My name is Dr. Hal Blattman of the Blattman Health and Wellness Center, and I'm here today with
Dr. David Ellison. I'm the Medical Director and Chief Scientific Officer for Region Medical Centers, Westchester, Ohio.
And what a pleasure for us to be here today. What we're here for is to bring you answers to medical questions. Medicine mystifies many people. How often do you go to a doctor, your knee still moves, and you've been told it's bone on bone and it needs to be replaced, and you have no alternative? How often do you have so many other things in medicine that you're just taught this is the way, and you don't even think, is there another way, but you don't like what you're hearing.
Sure.
You don't like what you're hearing at all. You're wondering, is there another way?
Yeah, nowadays with the introduction of the internet, the information highway, there's so much information out there, but that information can be more confusing and bring up more questions than it does answer for patients.
And how do you distill what's good information from not so good information? Everybody goes to WebMD, everybody goes to the major health centers, but major health centers all have a point of view that they want to convey. And it's not necessarily the best of alternative and the best of healing medicine, is it?
Well, medicine can be inherently biased. So if you go to a center that sells whatever it is that they sell or they specialize in, they're going to have a bias, not right or wrong, but they're going to have a bias in promoting that service. They may not educate you on the entire landscape of what all the options are, the risk-benefit of everything is. So that is a problem in medicine for sure.
So if we can help people get answers to these questions, and if we can help people demystify what is so mysterious, even the names of what we have been taught to call things in the language that we've read, if we can help people do that, then people can make better decisions for their own health care.
Yeah, absolutely. And that's what I see my job is. That's my purpose, is to educate. So when someone comes in, the primary of all of us as physicians really should approach it that way. Our primary objective is to give people an informed decision, which means they have to know all their options, they have to know the risk associated with all those options, they have to know all the benefits associated so they can make an informed decision.
And what does it take for you to be able to deliver that level of information? Because that level of information doesn't come from the traditional medical education. That's a very narrow focus. In order to get the education that you and I are talking about in this, how far have you had to go? How wide have you had to go?
Well, it takes a broad background. So you have to know not just something about everything, you have to know a good deal about what all the options are. So for me personally, I have a dual background. So I'm board certified in internal medicine. I had a long academic career and I taught, but I specialize, my passion and purpose is in regenerative medicine. That's what both of us do. So regenerative medicine focuses on health prevention. So we don't necessarily just focus on disease, we focus on preventing disease. And where disease is present, we focus on curing it. So a little different model of medicine. So for me, in my dual background, it really helps to have that academic, the internal medicine, and my regenerative and nutritional education so I can...
and we also go back and look for the root cause of the problem. Not just putting a Band-Aid on the issue, but how do you find out where is the root of this cause and how do you get the body to heal around that? So this education, we've had to go far and wide. Right. We read a lot. I spent hours every week reading and catching up and moving ahead and getting abreast of the latest information, because the technology that we're using and have been using since the start of our careers to stay on the cutting edge in medicine takes a tremendous amount of effort.
Yeah, it doesn't change monthly or even weekly. Medicine changes every day.
Every day. And
every day I wake up,
there's something new. Right. So what we hope to bring you is answers to your questions. We hope to be able to demystify medicine. We hope to be able to bring you an education that helps you make a better choice about your health care. In our next visit, our next episode, we're going to talk about how to demystify pain. My name is Hal Blattman, Blattman Health and Wellness Center, and
Dr. David Ellison, Region Medical Centers.
You have a wonderful day.
Thank you. David Ellison, Chief Scientific Officer and Medical Director for Regen Medical Centers in Westchester, Ohio. I'm here with
Dr. Hal Blattman, the Medical Director for Blattman Health and Wellness Center here in Blue Ash, Ohio.
And today we're going to talk about pain.
And where does it come from? How do you find out where it comes from? What do you do with it when you know? And does it really show up on an MRI scan and an X-ray?
So in my regenerative practice, we do a lot of PRP, which stands for platelet-rich plasma. We do allograft, or what some people call stem cell therapy. And we focus a lot on intra-articular injections, large joint injections such as shoulder or the knee. We treat foot pain, we treat wrist and hand pain. So we do this with PRP, with or without stem cells. And in my practice, that's the extent of the pain the pain spectrum that we treat. Now, Dr. Blattman, I know your practice here, you go far beyond what I do at Regen Medical Centers.
And we do those things also, but we find that so much of this pain, we also treat headaches a different way, and shoulders and necks and arms. But when we see a patient who comes to us with pain, we as the physician are being asked to play CSI to find out what it's coming from. And so we've developed what we call the Blattman method, which is 4 rules for playing CSI to figure out where does my pain come from. Rule number 1, we can't really believe where we think the pain is. The pain in the headache doesn't come from the head. The pain in the arm, left arm, could be a heart attack. How many people do you know with knee pain and they've had that joint replaced and the knee still hurts?
Right.
Pain doesn't come from where we think we feel. Rule number 2, it's not so important as we were taught what the pain feels like. How many times patients come to you and spend so much time describing it burns, it's numb, it tingles, it aches, it's sharp, it's stabbing, and we have all these descriptive words.
Yeah, all the time.
Isn't it interesting to know none of them matter and they don't make a difference? And the answer to that is twofold. One is the brain can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, and even sexual arousal comes from the same nervous system. And those terms are not diagnostic. We were taught that burning means something different than aching means something different than sharp. And if you talk to somebody in pain, more often than not, they might feel all those sensations at the same time and not be able to differentiate. And the way we were taught, if a patient really describes what they really feel, we might think they're not telling the truth or that they're crazy. See? Right. So that's rule number 2. So if you can't believe where you think you hurt, you can't believe what you think it feels like, rule 3 is what you can believe. You can totally believe that specifically, millimeter by millimeter through your body, where you're tender is either where the fascia that holds you together is tied in a knot, or where the fascia weaves to your body and holds you together, and the injury is.
Yeah.
And rule number 4, doing a very meticulous exam like that, the places that are most tender generally generate and are responsible for most of the pain people think they feel. So then our skill set is to be able to feel finer than an MRI and finer than a CT scan. The texture of the body will tell you where the injuries are. And then these regenerative medicine techniques, using platelet-rich plasma, prolotherapy, prolozone therapy, allograft procedures, we can get the body to heal in such amazing ways. We'll talk next time in our visits about, can the body really grow new cartilage? Because regenerating joints is so important. But today, understand that the pain is not what we were taught, and the healing for that pain is something we've never seen before. It's not taking Motrin, it's not taking medicine. Medicines don't fix this.
Sure. Yeah, this is counterintuitive to a lot of people, so pay attention, especially to the first 2. Your pain may not be coming where it's coming from, where your body senses it's coming from.
So just because
you can't interpret that pain.
You have a pain in your back, it may not be coming from your back, even though you have an x-ray that says you have a disc or you have this or that. Those problems are not necessarily the part of your injury.
So without the proper technique, you may not find the source for that pain.
One of the most fascinating studies was 30 years ago, looking at 100 men, 40 years of age, that have never had back pain, never had a back injury, 30% of them had a herniated disc. And 30% of that 30% had 2 or more herniated discs. So just because you have a herniated disc and you've been taught that that's causing your pain, that's not necessarily so.
Yeah, very interesting. So you see that on an imaging report, you immediately assume that's what it's coming from.
Because we were taught, if we can show an abnormality on an x-ray or a study close to where your problem is, doesn't matter whether it's a blood test or anything else,
right.
We can tell you your problem comes from what we see on this chest. Sometimes that's the right answer. Sometimes that requires a leap of faith we have no right to make.
But time to rethink it.
That's right.
Yeah.
And that's our time for today.
Yeah. Dr. David Ellison with Regen Medical Centers, Westchester, Ohio.
Hal Blattman, Blattman Health and Wellness Center in Blue Ash, Ohio. You have a wonderful day.
Thank you. Have a good day.
Hello, I'm Valerie Austin. I'm an author, journalist, and hypnotherapist. I'm the author of 7 books, including Self-Hypnosis Made Easy, which was out last year, and you can buy it from Amazon or in the bookshops. In the book, there is a terrific hypnotic suggestion called the Orange Liquid, which promotes the immune system and release of stress and negativity for anyone listening to this interview. You can get it free on my website, Immune Boost for You, which is the number 4.com, or my Facebook, Valerie Austin, HYP. Welcome to the Cutting Edge Medicine with Hal Blattman, MD. For the many who have chronic pain, whether it is migraine, low back pain, butt pain, or pelvic pain, since it is there, how do you figure out what really causing it and what has to happen to make it go away? The answers are not what we have been taught. Most of the time it's not the disc, not a pinched nerve, and inflammation is not what we think. My guest today is Dr. Hal Blattman. Dr. Blattman is a board-certified practitioner of integrative and holistic medicine, completed 2 years of training in orthopedic surgery. He later studied ergonomics during his residency in occupational and environmental medicine for American Board of Integrative Holistic Medicine. Migraine, what is it?
You know, when I was in medical school, we were taught that migraine was a really, really bad headache, made you throw up, you took a migraine medicine, and it went away. And we've learned so much about migraine since then, and we make a differentiation between migraine headache, tension headache, TMJ headache, and cluster headache. And what I'd like to suggest is that that's artificial. We need that nomenclature, we need those changes, because if we're going to have 2 groups doing research on migraine headaches, those 2 groups have to have migraine defined and have to agree that they're both treating migraines. But beyond that, it really doesn't make a lot of difference. The causes for all these headaches, for the most part, are the same. So, what causes it? Have you noticed that when you have a headache, the muscles in your upper shoulders and your neck and maybe your jaw are tight and more tender? Well, it's actually this tightness and tenderness that sends the pain to your head that we call migraine. We were taught also that migraine comes from blood vessels. Well, the migraine that you have does not come from your head. It does not come from your blood vessels. And then we're also taught that it can come from nerves. Well, the nerve that goes and attaches or comes out of your skull at the back of your head, where the little bump is and the muscles attach, that's the occipital nerve, and a lot of times you might get diagnosed with occipital neuralgia, like that nerve was causing the headache. And the doctor might take a needle and put the needle in to that very area and put in some Novocaine or lidocaine and some cortisone, and lo and behold, that might help many of these headaches get better for quite some time, at least a day or so, and that makes the neurologist think he's right, and that's an occipital neuralgia. But it really doesn't prove the point. Go back to what we said just a little bit ago about, have you noticed that there's places that in your muscles that are really tender when you have the headache and when you have the pain? Have you noticed that that muscle that goes across your upper shoulders is really tight, and if you squeeze on it, it's tender? Well, the headache comes from the injuries to the strings and cords of fascia that hold you together and go through your muscles, your upper shoulders, your upper back. It actually starts, most headaches, with the muscle over your shoulder blades, and then your upper traps, and then the back of your neck, and then the base of your skull gets tender. And some people, their jaw muscles are also involved. Not only the muscles outside that we might call the masseter, but the muscles inside that we call pterygoids. Any of these muscle structures in your head and neck can send pain to your head and neck that then becomes tension headache, cluster headache, migraine headache, and they're really not any different than that, except how you manifest them and what the subtle differences are between one or another that you would describe as symptoms. The cause, however, is mostly the strings that are tight in your head, neck, and jaw muscles and upper back. So, what do you do about it? You have to loosen these muscles in your neck and shoulders and upper back. You have to unkink the strings where they're knotted and kinked together, and then you have to get them to stretch out to their normal and healthy resting length so that they are no longer sending the signals of discomfort and pain that you interpret as headache. So if you look at the book, my book Winner's Guide to Pain Relief, there's a set of exercises and stretches for headaches that include how do you use a rubber ball to massage the muscles in your shoulder blades, upper back and upper shoulders, and even in your neck that are kinked and causing this pain. And as you massage them, they get looser, they get softer, and then you find that this headache pain, however you interpreted it, reduces and goes away, and it will be less. And how long will that last? It lasts until these muscles tighten back up, and as they tighten back up, you end up with more and more of the discomfort once it hits you. Well, what glues these muscles together when they get kinked and they get injured, what glues them together is often the inflammation that we get from our food. And inflammation is not what we were taught. We were designed to have inflammation in our body for repair and for defense. If we have an inflammatory reaction that's causing pain, we have a repair deficit, and we have more going on than we were able to handle, both by our resources and by the degree of injury. Well, most of that extra inflammation that gets in our way comes from bread flour, sugar, potatoes, dairy, fruit juice, artificial sweeteners. So, if you're having migraine headaches, what makes this day have a migraine? Could be the tightness in your shoulders, but underneath it could also be what you eat. So we coach people on how to change what they eat so that they can get rid of that inflammatory pain. And when you go to do that and you say, well, I mostly have that, if you really want to make the headache go away and you really want to be pain-free, there's almost no such thing as partial credit. So changes for many people have to be absolute because the trigger is a really tiny amount of the substance. Just think, what sets off the immune system in the person who's really allergic to bees? Do they have to get a lot of stings or just one teeny tiny one and they get into trouble? So sometimes these foods will make pain for a week, sometimes they'll make pain for 3 or 4 weeks. So the piece that you ate that tightened your fascia that made the headache go over the top could be something you had 2 weeks ago that's still in your body affecting the fascia that you tightened when you carried your book bag around for too many hours today.
Well, thank you. I've learnt so much today. I had no idea what was behind the headaches, and even though I've been a practitioner for 30 years, you've taught me a lot in this short interview.
You know, there's so much misconceptions about pain. Pain is not what we were taught. How to get out of pain is not what most of us do. What we were taught in medical school is roughly 10% effective for the pain that people have in their bodies. Otherwise, we wouldn't have so many people still in chronic pain, and so many people who don't admit to chronic pain treat it with over-the-counter remedies. What we're teaching, and this different model for understanding how pain even happens in the body, is better than 90% effective in most people with chronic pain, no matter how many years you've had it. And that paradigm change and paradigm shift really needs to get to people who can do so much to help themselves. And there is no reason you need to be in pain as you get older. There is so much you can do so that the injuries of your lifetime that you carry around in your fascia that make your strings tight, glue together, and kink, those injuries from a lifetime can many times be reversed, and pain of a lifetime can often be made to get much, much better.
Well, I have to say I'm going to buy your book because it's been fascinating. Pain is not what we're taught, it's not what we think it is, and most of all, it can go away. For more information, you can check out www.blackmanhealthandwellness.com, where you can learn a lot for self-help and get information about Dr. Blackman's Saturday morning talk via Zoom and private sessions. You can also purchase his book, Winner's Guide to Pain Relief, and the rubber ball that goes with it. Great for you to do-it-yourselfer who wants to get their fascia in better shape and get out of pain. When traveling is allowed, which hopefully be soon, he has the office in New York City and can also see him in Seattle. His main office is in Cincinnati, Ohio, and his telephone number is 844-282-8900. My name is Valerie Austin, and I'd like to hear from you myself. And if you want to find me on my Facebook, it's under Valerie Austin HYP, or my book is Self-Hypnosis, The Easy Way. And hopefully I'll hear from you. And again, thank you, Dr. Blackman. It's been fascinating.
Thank you so much, Valerie.
Be sure to take advantage of our current sale. Get 25% off of all of our IV therapy treatments in the month of February. Hydrate and heal faster and give your immune system a boost after the long winter cold. Try one of our many IV solutions, including vitamin C, Myers cocktail, mistletoe, and more. IV therapy is great for those suffering from fatigue, recovering from chemotherapy, have frequent migraines, and many other conditions. This is a limited time offer. Book now while supplies last. See the front desk for more details.
Hello, I'm Valerie Austin. I'm an author, journalist, and hypnotherapist. I'm the author of 7 books, including Self-Hypnosis Made Easy, which was out last year, and you can buy it from Amazon or in the bookshops. In the book, there is a terrific hypnotic suggestion called the Orange Liquid, which promotes the immune system and release of stress and negativity for anyone listening to this interview. You can get it free on my website, Immune Boost for You, which is the number 4.com. or my Facebook, Valerie Austin HYP. Welcome to the Cutting Edge Medicine with Hal Blackman, MD. For the many who have chronic pain, whether it is migraine, low back pain, butt pain, or pelvic pain, since it is there, how do you figure out what really causing it and what has to happen to make it go away? The answers are not what we have been taught. Most of the time it's not the disc, not a pinched nerve, and inflammation is not what we think. My guest today is Dr. Hal Blackman. Dr. Blackman is a board-certified practitioner of integrative and holistic medicine, completed 2 years of training in orthopedic surgery. He later studied ergonomics during his residency in occupational and environmental medicine for American Board of Integrative Holistic Medicine. Carpal tunnel. How do I know I have it?
Most people with carpal tunnel syndrome wake up with their hands and fingers numb and maybe in pain, and they shake their hand to wake it up. They go to their doctor and complain about that, and the doctor may send them for an EMG test. That's where another doctor puts needles underneath the skin in your forearm and in your hand and sends electric impulses down your hand to measure how well the nerves are working, and if the nerve, the median nerve that goes through the carpal tunnel, is injured, this test reflects it. There's a much easier way to tell, and you can tell at home. Just sit on a table with your elbows on the table and your arms bent and your forearms straight up in the air, and drop your wrist so it's bent about 90 degrees, just flexed forward, palm down. If your index, thumb, and long finger go numb or your symptoms increase during the next 45 to 60 seconds, you can bet there's a good chance you have carpal tunnel syndrome and that nerve has been injured that goes through your wrist.
What causes it?
Well, there are different theories for what causes carpal tunnel syndrome, but basically something has to injure the nerve as it goes through your carpal canal. The most predominant theory is that if you use your fingers for repetitive motion and you open and close them a lot, those tendons go through this carpal canal and they get inflamed because they are doing it a lot. And if they get inflamed, it makes them swell a little bit, and there's no extra space in this carpal canal, so the nerve, the median nerve, gets squished and pushed on, and that causes the injury that caused the symptoms. Well, that's been the predominant theory for many years, and as a result of that, there's a surgery we'll talk about in a little bit that has been used for many years to treat it. But if during that surgery you send the cover of these so-called inflamed tendons off to the pathology lab, there's no evidence of inflammation and inflammatory cells to support that theory as the basis for carpal tunnel syndrome. So there's two others that we'd like to talk about. One is, in order to use your fingers in a repetitive way, you have to hold your wrist still enough to know where everything is, and to do that, that requires a sustained contraction of your biceps muscle. Well, the biceps muscle may end where it attaches up by your elbow, but the fascia that goes through that muscle goes all the way down to your wrist. And as the biceps fascia tightens, your forearm fascia tightens, and then the ligament that goes across the palm side of the carpal tunnel also tightens. And it's not that the structures inside swell and don't have room, it's more that the canal itself closes down and squishes on the nerve. There is a way to treat that. We'll talk about that in a few minutes. Let's talk about the third theory. And the third theory is that many people, unbeknownst to them, use their hand as a hammer through their lifetime and use their palm to beat on things, to adjust things, to loosen things. And that creates an injury between the ligament that goes over the carpal canal and that nerve that goes right underneath it. And that injury makes stickiness between the nerve and the ligament, so that now when you open and close your fingers, the nerve gets tugged on. And the nerve that gets repeatedly tugged on is not going to work so well, and you're going to start to have symptoms that are carpal tunnel syndrome.
How do I make it go away?
Well, if you believe in the first theory, then you go to a surgery that cuts the carpal ligament that goes across the palm side of your wrist. And that surgery has a few weeks of recovery time, and 50% of people do well, and 50% of people don't do so well, and depending who you read, about 30% of people have a consequence that leaves them with pain or disability or problems for the rest of their lives. If you pay attention to the second theory of the fascia has tightened and so has the carpal ligament tightened, then there are some stretches that have been described in the osteopathic medical literature back in the mid-1990s that teach you how to stretch your biceps muscle, teach you how to stretch your forearm, teach you how to put your hands or your partner's hands on the ligament itself and force it to stretch. And we've described those stretches in my book, Winner's Guide to Pain Relief. There's a nice section on carpal tunnel that describes how to do this. And the articles in 1990s showed that you can actually convert someone who has a positive EMG test, the so-called gold standard for proving you have carpal tunnel syndrome, and watch that test convert to negative. Those stretches alone help a lot of people make their carpal tunnel symptoms go away. The third theory, talking about how we use the hand as a hammer and we have an injury between the ligament and the nerve causing adhesions or stickiness, we actually do a needle surgery for that. And we take some Novocaine, we make the skin numb, and we thread a needle between the nerve and the transverse carpal ligament, watching this under ultrasound so we know the needle's in the right place, and inject fluid so that we can separate the nerve from the ligament and get rid of that stickiness, those adhesions, and that scar tissue. And by the time we're done with that, the nerve can move freely in the canal as you open and close your hand. Your recovery is pretty minimal. A couple more days with your brace, and your nerve and your hand may recover just with that. We have about a 90% success rate in that, and 30% of those people end up needing a second procedure. We have no bad results. And so we know that that theory also holds some water and can contribute towards causing carpal tunnel syndrome.
We're about out of time now, and this has really been very interesting. I want to thank you, Dr. Blettman, for a fascinating discussion. Pain is not what we thought, it is not what we think it is, and most of all, it can go away. For more information, check out www.blattmanhealthandwellness.com. That is www.blattmanhealthandwellness.com. wellness.com, where you can learn a lot of self-help and get information about Dr. Blackman's Saturday morning talk via Zoom and private sessions. You can also purchase his popular book, Winner's Guide to Pain Relief, and the rubber ball that goes with it. Great for the do-it-yourselfers who wants to get their fascia in better shape and get out of pain. When travel is allowed again, he has an office in New York City and can also see you in Seattle. His main office is in Cincinnati, Ohio. His telephone number is 844-282-8900, and if you'd like to look at getting yourself in order again and getting some stress relief, you can always go on my free site and download Orange Liquid. But thank you so much, Dr. Blackman. It's been very interesting because I've been worried about carpal tunnel because I was worried I was getting it, but giving that exercise has been very helpful. Thank you very much.
You're so welcome. Thank you.
How do I figure it out? And how do I make it go away? Do you suffer with chronic pain? Have you been told about your discs and nerves that you might need surgery? Have you had lots of procedures, perhaps epidural steroid injections and radio frequency to kill your nerves, and you still suffer with pain? The pain always comes back, and the medicine only works so much, and not always enough no matter how much you take. I'm Dr. Hal Blattman, and we at the Blattman Health and Wellness Center offer much different answers for your treatment. Our treatment is based on helping your body heal from its old and unhealed injuries. The basic difference starts with taking the time to listen and carefully do a hands-on examination of your body and fascia with 4 basic rules of how our bodies tell our brains about injury. Rule number 1, you can't believe where you think you hurt. 2 of the best examples are that headaches do not come from your head, and left arm pain can come from a heart attack. In a similar fashion, your lower back pain may not come from your lower back, and foot pain might not come from your feet or the heel spur. Rule number 2, you can't believe what you think the pain feels like. Our brain cannot tell the difference between numbness, tingling, burning, sharp, dull, achy, even itch and tickle. And these sensations are transmitted by the same parts of our nervous system, and they get confused. Moreover, we can feel all or any of these sensations at the same time. If you tell someone what you really think you feel, deep down you're concerned that the practitioner might think you're nuts. Rule number 3, you can totally believe where you are specifically tender. That's why our examination is so very important, and the most tender places are either the knots in your muscles or the places where your more serious fascia injuries are actually located. Rule number 4, when you hurt, the places where you are most tender generate most of the pain most of the time. And rule number 5, when treatment helps to heal these areas of injury, and you also work to reduce the inflammation in your body that is caused by your food, most of your pain can go away. Unfortunately, very few medical caregivers have the physical examination skills to carefully examine the fascia of your body. For example, has your doctor ever really touched you? If you're tired of injections and medication that might make you constipated, impotent, sleepy, forgetful, and only provide temporary relief, and you're ready for something different, treatment that works for healing injuries of your lifetime that cause chronic pain, call today for a consultation at the Blattman Health and Wellness Center. We will carefully examine and help you understand where pain comes from and what your body needs to do for the pain to go away. Treatment will start with learning to avoid inflammatory food, gentle detoxification, and home massage and myofascial release as instructed by our staff.
Welcome.
Thank
Good
you.
to see you
Good to
again.
be here.
You were here just a few weeks ago.
3 weeks ago this coming Wednesday.
With which issue?
With back pain, lower back pain.
And it came on you all of a sudden?
Acutely about 4 days before.
Had you had this happen to you in the past?
About 5 times since I was 25.
And each time, what does it take to make that go away?
Time, bed rest, prayer.
And how long does it take?
Typically 7-9 days on average, if I remember correctly.
Okay, so this time you happen to be here.
Mm-hmm.
We got you within a few days of its onset, and you came in and we did some trigger point injections. Mm-hmm. You worked on changing some food things that you ate, and you used a little rubber ball.
Yep.
And how was this time different?
Night and day. The recovery time after the procedure, everything, I was probably feeling better within 3.5 days. Stiff, but I was 100% better even leaving the office after the injections, the trigger point injections were done. I was able to walk upright with very little pain. I was still a little bit stiff, but yeah.
So you were able to find out very quickly that this pain that had been attributed to issues in your lower back really feels like it's in your lower back, but it didn't come from there at all.
And I had no idea. I would have never have known until you did the diagnostic before we did the procedure to determine exactly what was going on. And yeah, that was a surprise.
And do you have anything, a previous MRI scan of your back anywhere?
No.
No. And so this examination was just done by touch. And that's really key. All right. Well, thank you very much.
Thank you very much.
Have a wonderful day.
You too. Thank you.
Be sure to take advantage of our current sale. Get 25% off of all of our IV therapy treatments in the month of February. Hydrate and heal faster and give your immune system a boost after the long winter cold. Try one of our many IV solutions, including vitamin C, Myers cocktail, mistletoe, and more. IV therapy is great for those suffering from fatigue, recovering from chemotherapy, have frequent migraines, and many other conditions. This is a limited time offer. Book now while supplies last. See the front desk for more details.
Hi there. My name is Hal Blattman. I'm a medical physician and medical director of the Blattman Health and Wellness Center. And I'm here with TJ Lonergan.
And I'm clinic director for Impact Health and Spine Centers. I'm a chiropractor.
And we're going to talk today about neuropathy. And the first part we're going to talk about is, what is neuropathy?
So most people don't know what neuropathy means. It's just something they get, a term they hear at a doctor's office, and then you go home, you try to Google it, and you wonder, what the heck is this?
Right. And neuropathy has to do with damage to your nerves. And we usually talk about peripheral neuropathy, because central neuropathy happens in your brain, and peripheral is everything outside of that. And mostly it affects hands and feet, fingers and toes. And the symptoms would be what?
Well, from the word neuropathy, the pathy means pathos, something wrong. And so something's not right. It's an altered sensation. And that can be anything from your feet are cold, but then you touch them and they're warm.
Right.
Or your feet are warm, but they feel cold.
Right.
Or you think you're walking on rocks.
Yeah, or pins and needles.
Pins and needles.
Numbness.
You feel like your feet are wood, blocks of wood you're carrying
around. So your
around.
nerves are not working, and they're not working the way they should, and so your sensation is altered anywhere from numbness to pain.
Yeah.
All of that can happen. And why does it affect mostly your fingers and your toes before it affects other pieces?
Well, because in those areas, the nerve endings are very sensitive, because we're out there finding the world.
And those are the tiny nerve endings supplied their nutrition by the tiny blood vessels, and the injuries to these areas happen first and more severely than the ones to the bigger nerves in our more central nervous system. And what kinds of things cause those injuries?
Well, for a lot of people, it can be diabetes. About 70% of diabetics will get a diabetic neuropathy. Chemotherapy is a big one, because it affects how the nutrition and the health of those little sensory nerves, those little sensitive nerves, is managed and maintained. And then anything else that affects this nerve itself being able to signal from the brain all the way down to the toe, anywhere along the line there can be problems that can add to this.
And these injuries can either be a direct injury by a drug that causes injury to the nerve, or it can be a lack of blood supply, like in diabetes, extra what we call oxidative stress that damages all kinds of parts of our body, and the nerves don't survive so well and they sustain this kind of injury.
And then you get these those little electrical shorts in the system, and you start getting either misinformation or no information, and you start getting, in the end game, death of the tissue.
And people think especially of peripheral neuropathy, but I think we want to make the point that it doesn't happen in isolation just in the periphery. You've got tiny nerves in your heart, tiny nerves all through your body that also get injured at the same time. You only notice it in your fingers and your toes because you touch things. If your heart could touch things and you would feel that, you'd think much differently about this whole concept. So
you're saying the Tin Man who doesn't have a heart wouldn't feel this?
You might not feel it at all. That's exactly right. And don't think that the injuries to your fingers and your toes are happening in isolation, just in your fingers and toes. This injury from chemotherapy and diabetes is all over your body.
Because, the diabetes is having to do with the blood, and the blood's everywhere. The chemotherapy is put into your blood, in which it's going everywhere.
And oxidative stress from those is everywhere.
And when you have your fingers and toes being the furthest thing away from home,
right,
way out there, like kids away at college, that's where
you can't watch over them.
You can't watch them over every second.
That's right.
And you got to make sure everything's happening. That the proper exchange of nutrients is happening. That all the groceries are getting in the house, and all the garbage is getting out of the house.
So hopefully, this little interchange will help you understand what is a neuropathy and how do you get it. I'm Hal Blattman of the Blattman Health and Wellness Center, here today with
TJ Lonergan with Impact Health and Spine Centers.
And you have a wonderful day.
I'm Dr. TJ Lonergan with the Impact Health and Spine Centers, and I'm here with Dr. Hal Blattman,
Medical Director for the Blattman Health and Wellness Center.
And we're going to talk to you a little bit about what you can do to prevent a neuropathy.
Right. How do you prevent it? Like your nerves are about to be damaged, or you've got an illness, or you're taking medicines that could injure your nerves. How can you protect them?
Well, one, a lot of this comes back to your diet. It's a really simple thing that you can do for yourself outside of seeking counsel from somebody who can give you a little bit more specific things on what to do. And one of the major things you want to look at in your diet is what, Hal?
I think that you want to stop eating the things that can cause further oxidative stress or further injury to your nervous system. So that's going to be bread flour, sugar, artificial sweeteners. The things on the inflammatory food list need to come out of your diet.
Where do I find an inflammatory food list?
I think you might find that online.
Right.
Right.
And keep it real simple.
Or you can sign up for our newsletter and download what we call the Do Not Eat list.
And so these are things that you can do specifically for yourself. But another thing you can do besides just the food at the grocery store is you can look into supplementation. There's a lot of good supplementation, nutritional supplements that can help you kind of prevent and fight this and raise your resistance to this happening.
And we've used these nutritional supplements to prevent and also reverse diabetic neuropathy for many years. And they also will help protect the nervous system from a chemotherapy neuropathy.
So if I'm hearing you right, Hal, I can actually do something myself to help my neuropathy and help my health, and I'm not stuck with this the rest of my life potentially.
Yeah, we'll talk about that in our next episode, but you can actually prevent it if you do these things while you're being injured from your chemotherapy or your diabetes. You can help prevent the damage to your nervous system. But it's not always that. Sometimes that neuropathy is mistaken from something else that's going on in the body, and it's not just a neuropathy.
Sure.
Like
when you're following the nerve back up, that nerve's got to make it all the way back up to the brain. It's got to go from the brain all the way back down to the toes or the fingers, and anything that's disrupting that signal anywhere along the line can have a problem. And it could be something as simple as in the spine itself and how it's motioning or moving. That's why something like yoga or Tai Chi or just a daily walk or getting in a swimming pool can keep that spine loosened up so that those signals run free and there's less potential for a problem to happen.
Right.
So if you're kind of getting it on the physical side and keeping yourself healthy, and you're getting it on the chemical side and keeping yourself healthy, we want you to know also from a mental perspective that you can get yourself healthy. It's not just a fait accompli.
We also see people who have very, very tight calf muscles and very tight legs. And that fascia tightness can interrupt blood supply to the nerves, make the environment very toxic. And for those people, they have something called an idiopathic neuropathy. They don't have diabetes, they've never had chemotherapy. And what we find in those people is it's not really a neuropathy. If we can release the fascia and detoxify the fascia in the legs, the feeling and sensation come back.
So the big question here is, what do I do? And I think, we're going to talk about that here in a minute. But what we want you to know is that there's options.
Right. There are options to do, and you're not just destined to not be able to feel your fingers and your toes. You can actually protect them and clean up your act.
Well, I've learned a lot today, Dr. Hal, and I think this has been great. And we hope that you're learning a lot from this too. And we really invite you to send us questions, and we'd love to answer them for you. I'm Dr. TJ Lonergan with Impact Health and Spine Centers.
And I'm Dr. Hal Blattman, Medical Director of the Blattman Health and Wellness Center. You have a nice day.
Hello, I'm Dr. TJ Lonergan with Impact Health and Spine Centers, and I'm sitting here with Dr.
Hal Blattman, Medical Director of the Blattman Health and Wellness Center. And today we're going to talk about, let's say you have a neuropathy. Your fingers are in trouble, your toes are in trouble. What do you do? Is there a way to recover? Are you destined to have that pain, discomfort, numbness, walking on coals for the rest of your life?
You got options. That's a big thing for us to be able to explain to you, is that there's a lot you can do. And we talked a little bit earlier in a prior video about what you can do nutritionally for yourself. There's a lot of options at the grocery store, but beyond that, you want to get more specific, there's more that can be done out there in the healthcare community. And one thing in particular that most people don't know about and they've heard a little bit about is stem cells, Hal.
Stem cells are a very new and an important treatment. If you inject them into the body, they will go to where your body is setting up signal flares where it needs help. And they can latch onto blood vessels nearby and secrete all kinds of growth factors and signals to help your body recover from injury. And there is potential to use that for neuropathy.
And getting that nutrition back into that nerve, that sensitive nerve that's being affected, and that's the reason why you're getting all these altered sensations and it's affecting how you live your life. Beyond just those stem cells, you can also use some supplementation. Talk to us about some specific things in supplementation that really help out.
Nutritional supplements are the ones that we've used for diabetes and diabetic neuropathy for years. They're N-acetylcysteine and alpha-lipoic acid are two of the really big agents that you can use. There's also herbal medicines that can be done. And one of the most fascinating things that helps put energy of healing into the body is infrared light. All kinds of so-called cold laser devices and infrared light devices can help the nervous system recover from an injury.
And when you think of these kind of infrared lights and low-level laser therapy or cold laser therapy, what you're really talking about is these have wavelengths and properties. That's why it's a red light or an infrared. It's on the spectrum. And so these wavelengths and these frequencies signal, again, send up these signal flares you're talking about, like with stem cells.
Right.
As they stimulate the body to kind of heal itself, right?
And they put energy in the body that the body can use for these healing purposes. And then it's important to eat clean, eat well. We eat for two reasons. We might think we eat because we're hungry. We might think we eat because it tastes good. But that governs what we eat and when. The reason why we eat is two. One is to get fuel to burn, to make energy, and the other is to get raw materials to build new parts. So when your body's trying to repair your nervous system, what's the quality of raw materials you're giving your body to build these new parts is so important.
So that's why we want to keep it simple and clean, because there's enough that the body's got to do. You don't need another activity that it has to do.
Exactly.
And then one thing that we like to do at Impact Health and Spine Centers is we're looking specifically on the nerve signal that's going from the brain down to those toes to make sure everything is actually working correctly. If that signal isn't clean itself, it just makes everything tougher. You're going to need more of that infrared energy.
Exactly.
To get things done. And then, as Hal brought up before, if you're having issues with the fascia or with the muscles in the forearms and the legs, that's also going to affect things. How so, Hal?
Because it's going to kink blood supply, it's going to affect and kink nerves, but it's also going to interrupt blood flow into the muscle, which makes that environment much more toxic as you use those muscles, and you can't wash the exhaust out of the muscle, and that increases the toxicity to the nervous system.
So if we can get that blood flowing a lot better, and we can get the quality of the supplies that are being carried within that blood to be cleaner and simpler from your diet, then there's a lot you can do to recover from peripheral neuropathy, and it doesn't have to be something that you have to suffer with unduly for a long time.
So people need to know that there's hope for all these conditions that conventional medicine may not have the answer for. And when you try to wonder, what should I do first, second, or third, and how will I know if which thing made the most difference? Your body doesn't work that way. Your body needs everything done at once, because you need all the parts done at once. You don't build a bridge by putting all the bolts in from one side, and then you go back at the end and put all the nuts in on the other side. You put them both together at the same time. You need all the parts to make things work. So you don't just do one thing at a time. You do everything that you know, and then you see how much change you can affect.
So get out there and build your team, and if you need some help with that, please reach out to myself, Dr. TJ Long at Impact Health and Spine Centers, and
Dr. Hal Blattman, Medical Director, Blattman Health and Wellness Center, and you have a nice day.
Lots of people in the world have headaches, and many people find these headaches disabling. What you're not taught is that headaches do not come from your head. It feels like it comes from your head, but your headache doesn't come from your head, it doesn't come from your blood vessels, it doesn't come from your nerves, and medicine pretty much doesn't have the paradigm that helps you. You take migraine medicine, your headaches come back. You take other headache medicines, they come back. One could argue that the medicines don't work because nothing really makes it go away, and that's because all the medicines are dealing with the idea that your headache comes from your head, and it doesn't. Your headache comes from a lifetime of injuries to the fascia and the muscles that make your head and your jaw move. For example, just take a look at this picture. You have tight upper traps, they're really tender, they make this headache. You have tight muscle here. This muscle and these injuries at the ends of this muscle make this trigeminal neuralgia and migraine headache pain. So instead of thinking that your headache comes from your head and taking medicine for the rest of your life that drives you into a corner and gets you nowhere, come learn how to make this fascia injury repair and your headaches go away.
Hi there, I'm Hal Blattman, MD, and I'd like to take just a minute and talk to you about head and neck pain. Are you able to take this muscle, just wrap your fingers around it, it's a pretty big muscle, and can you feel there's ropes and cords inside this muscle? And can you also feel that they're surprisingly tender in some places? Now, take your finger and touch the top of your collarbone. Push down and massage just the very top, and you'll feel little irregularities that are also surprisingly tender. Well, this is the injury that causes that. And the way you got that injury, you might have been an infant, and somebody picked you up by your shoulders and forgot to bring your head. Another time it happened, you were in nursery school, and somebody not happy with you came up behind you right before morning recess and shoved you to the ground, snapped your head back, and tore where the cords and strings that go through this muscle weave through the cover of this before they come down into your chest. And the results of that, through this time, here's one end of the injury, here's the other end of the injury, here's the kinks in this muscle, and here's the pain pattern of headache that causes.
When you go to figure out where headaches come from, the best thing to do is examine and touch the fascia that holds your body together and see where it's tender. For example, you can grab hold of this muscle right here, a big thick muscle, about as big as your thumb. And if you run your hands over it, you can feel that there's ropes and cords in this muscle, surprisingly tender. Now, take your finger and go over the top of your collarbone, not the front, but push down on the top and run your finger along it. You'll feel little irregularities that might be also surprisingly tender. Well, this is the injury that causes this rope. And the first time you got that injury, you were an infant, and somebody picked you up by your shoulders, forgot to bring your head. Another time it happened, you were on the playground, 6 years old. Some little kid came up behind you, shoved you to the ground, snapped your head back, and tore where the strings and cords of fascia that go through this muscle and hold it together weave through the cover over this bone to anchor and hold you before they come down into your chest. Take your hand, get a big bite of your pec muscle, run your thumb across it, and feel the ropes and cords in there that are surprisingly tender. Well, you got that injury when you got up off the playground floor and pushed that little kid back. What's the significance? Well, take a look at this. This is one end of the injury. This is the other end of the injury because you're also tender in the back of your head. These are the kinks in those fascia cords and strings that go through this muscle. And this is the migraine and trigeminal neuralgia pain that comes from these injuries and these kinks. Again, let me remind you, your headache does not come from your head unless you're having a stroke or some other terrible thing. Headaches do not come from your head.
Well, good morning, and thanks for speaking a few words for people that are interested in watching and learning about this. You're feeling really good, and there's a few things that we attribute that to. One of them is food changes. Can you talk a little bit about what you've done?
Yes, meeting Dr. Blackman a few years ago, he told me to get a book named Sugar Blues and read it, and I did that. And it really helped me to change my diet, the way I ate. I got away from sugar. When I did that, there was less pain.
And then you had some rotator cuff issues and some shoulder issues, and we used platelet-rich plasma from your blood to help you grow new tendons. And how's that shoulder feeling? How bad was it, and how are you doing now?
After surgery, there was severe pain where I could not sleep. It was hard for me to sit and work, to do anything. So Dr. Blackman told me no more surgery, to get the injection, stem cell.
It was the platelet-rich plasma.
Yes.
Right?
I came, received that, and I'm so grateful today. I'm almost pain-free. With the eating healthy and clean and the stem cell, I am enjoying life now, and I am very, very grateful.
Thank you.